Namaste everyone, I'm Dr. Ruhi Agarwala, founder of Functional Medicine Clinic and a founding member of IAFM. Autoimmune conditions are still a mystery for the conventional medical system. Through the functional medicine lens, we look at the root cause of diseases, and gut microbiome plays a very important role here. So in the next 30 minutes, we will hear from Dr. Anjali Hooda about gut microbiome and its role in autoimmunity. Dr. Hooda is a functional medicine expert and author of the book called Think, Eat, Live Smart. So over to you, Dr. Hooda.
Hi, everyone. Good morning. It's a great start, Preeti. Thank you so much for this amazing zeal and enthusiasm that you've put in minds of all of us. And without wasting much time, I know we have limited time today, and I would like to start my session, which is on gut. And I'm going to share the screen right now. I hope everyone can see that. Just confirm.
Yes.
Okay, great. So I want to talk about gut. I know most of the functional practitioners are already probably aware of all this, what I'm going to talk about, but I'm going to share some of my wisdom and pearls, some of my learning points, which I've experienced through practice and experienced through making mistakes. Like Preeti said, we all make mistakes and we all learn from them. So gut is my favorite topic, and rightly Preeti chose me for it, and I'm very happy to share. So gut microbiome, you know that the gut immunity, the immunity of the body basically lies 70% is in the gut. And although we don't appreciate that, we always have, when you think about immunity, you're thinking about oral cavity, nasal, respiratory, but your GI tract has major immune defense mechanism. And so all the microbes that you get from food are either filtered out or absorbed back. And that's why a lot of the microbiome is getting altered all the time. It is a constantly changing microbiome. And because it is set, the basis of the microbiome is set in the early infancy. You know, whether you're a C-section child or you're getting through the birth canal, and whether you're breastfed or not, those are the setting stones for your gut microbiome. So breast feeding history is going to be one of the most important history in every patient of functional medicine. Gut microbiome is, there's a dysbiosis that happens. We all know, as medical experts or who are not medical experts, we know that there are the galls and the PPLs and ILs and LPLs, they make these are all lymphoid patches or lymphoid tissue, which has strong cells, the B cells and the T cells. They make up the immunity, and they're all in the lining of the gut. So you can imagine how strong this immune system is, how robust this system is, and if it gets altered, how much you can probably get almost all diseases if this system gets hampered. I'm more focusing on how autoimmunity happens, but you understand that most of the illnesses that are coming are from the gut issues. So as I said, this is a barrier. One of the most important components that you will see on a DNA stool test is going to be the IgA, which I will talk about later. So it can be high, low. So IgA is basically your he's the sentry. He or she, IgA is basically regulating your in and out. So IgA and pairs patches and everything, those are going to be very important. And how IgA can and how you can treat it is going to be it's great how you can treat it, and it's only a part of functional medicine where I've learned how to treat this damage in the mucosal lining. How do you approach a case? Now, the most important thing that I want to tell you about is how to take history. History is very important. When we talk as functional medicine experts, we are going to the root cause. So if we don't take the history from birth to now, we are really doing injustice. We need every kind of history. We need whether we want to know whether they were hospitalized, whether they had fever, did they have a mental issue, emotional breakdown, or anything that happens. Even if for girls, you want to know when did they first start their period. You want to know everything from birth to now, because a lot of things are happening in the time early on in life, which is sort of going on and on. And by the time patient comes to you, they've already experienced many things, and you need to pinpoint where it went wrong. So that's why it's very important. Focus on the type of birth, as I said, about the C-section and the normal birth canal, and breastfeeding as a child. If the patient is bottle fed as a child, you will know as we go on further discussing that bottle feeding can be having great consequences on the gut microbiome. Make sure that you assess the dysbiosis on history. Don't just rely on testing. I think the first thing is to, which I used to always do, I did much lower testing than many people. Um, Prolonged antibiotic use, very important history. You will know whether this patient has, already the bad bugs. Then MSQ question, medical symptom questionnaire, which is a pretty much a document is available on Google. This can be done at the first visit and the second and the third and the subsequent visit to see how the patient progresses, because they need to see how they, there's one, there is a feeling in the patient, okay, I'm feeling better. Second is to keep scoring out and see if the patient is actually improving, and what are the major, where did you circle the most on the MSQ, and are those things getting better? Sometimes patient comes with something else, and something else starts getting better, and the basic issue doesn't get solved. This happens a lot. So you want to make sure that you have all the MSQ questionnaire forms every time the patient comes. This is my take. Candida screening questionnaire, I do a lot of that, because a lot of patients will present with a fungal infection. They'll have, ringworms, or let's say any kind of maybe scalp, they have excessive seborrhea and stuff like that. So you want to do a Candida screening questionnaire. PHQ-9 is one of the questionnaires that I do. I don't know if anyone else has ever done it, but PHQ-9 is a basic mental health questionnaire, which is a basic screening without going too much into detail. It's a mental health questionnaire. It's available, again, the forms are available on Google. And then of course, gut dysfunction patients are already going to tell you they have bloating, or they have loose stools, or they have constipation. Very, very common. Bloating and constipation are one of the most common presenting symptoms of 90% of the patients, apart from body aches and apart from having rheumatoid arthritis, etc. DNA stool testing will be showing you a report of a patient, just for you to understand what it looks like and how you can actually troubleshoot. Diet history, as you all know, I have a nutrition background as well. So I focus a lot on the diet history, and basically just take about 2 weeks of diet history. Don't go too much into detail. They will say they used to eat this, they used to, just focus on that. Medication history, of course, you have to really, really grill them about the use of PPIs, the proton pump inhibitors, for example, I think omeprazole, like whatever the brands are available. Antibiotics, you want to know about antibiotics, and NSAID. NSAID use is very, very common, and they don't know what is NSAID, so you have to tell them, you have to ask. You have to ask those things. NSAIDs are very, very, they're the villains in causing leaky gut. So NSAID history is very important. History of weight gain or weight loss, of course, you want to know that, because that will also tell you whether the patient is already heading towards pre-diabetes or fatty liver, etc. Aches and pains, patient will definitely complain, but you also need to, I would do the fibromyalgia, the points, or the fibromyalgia points that we have, just to assess, there is a ongoing issue. So you want to do the full physical exam, including from head to toe. You want to do all the review of systems, and you want to see everything. You want to see their nails, you want to see their tongue, you want to see the mucosa inside, you want to see their dental, they want to see mercury fillings. So don't miss anything, because physical exam is going to be one of the most important gateway into someone's health, as other testing is also, but physical exam, if we find things, then we can also order testing accordingly. Um, blood work, usual blood work is fine. I don't want to spend too much time on this because I think everybody knows the blood work to be ordered. My personal opinion on blood tests will be, I definitely order. So I've only written the pertinent ones that I definitely order. Will be definitely the inflammation markers. I will order the cortisol, because you will see that without doing the 4-point, there is a salivary cortisol, 4-point salivary cortisol testing, which is a later on test. But to assess somebody, just screen their cortisol, you can see that, most of them will have 27, 30, 35, like that. The cortisol, but 9 a.m. cortisol. You can do an evening one, you can do 3 times in a day in a blood, but it's like, pricking the patient again is not a great idea. Salivary will be done for most autoimmune patients. I would do a 4-point salivary test later. Nutritional labs, that you all know, DNA stool test we'll be talking about. What DNA is basically, stool test will tell you all the bacteria, the fungus, and the parasites, whatever, all the bugs in your intestine are reflected in your stool. So that's what we're going to do. And we're going to talk about the calprotectin. Calprotectin is basically I've literally mentioned pretty much everything on the slide. So you want to see the calprotectin for the IBD patients, the inflammatory bowel disease, and the zonulin necessarily may not only be in IBD, it may be with other conditions associated, because zonulin is basically your tight junctions of the intestine lining. So if zonulin is sort of damaged, then you will see it on the report. IgA, as I told you, one of the biggest defense mechanisms, so it can be high or low depending on what the patient has. Elastase is basically your pancreatic, tells you your pancreatic health. And if it's insufficient, the elastase is too low, less than 200, then you know that you're going to be having to supplement this person with enzymes, and of course look at the dysbiosis. Beta glucuronidase is one of the most important things that we'll see on the slide, and I probably will talk about it in the next one. So here is a snapshot of the first part of someone's test, and you can see that this part of the test looks very normal. There's literally nothing here, and these are all normal. So here is when the problem we start seeing. So we start seeing a little bit of H. pylori. We start seeing little bit of Escherichia, a little bit of, and then very low Bacteroides and very low, Firmicutes. And you will see that, then you see these high values. And then, the first time when I saw a GI map, I was in an autoimmune patient. So this is an autoimmune condition. This patient has RA already. So how you can tell without even doing their rheumatoid labs, you can tell that this patient has RA. You can see the high values here. You can see most of them are related to the rheumatoid arthritis. And you also see this Fusobacterium. Now, Fusobacterium, I wanted to tell you a little bit more about this, because this is one of the ones, this is associated with systemic sclerosis and rheumatoid arthritis. So you see that this value is high, although it's not labeled high, but for me, this patient's value is high. Now, okay, so this patient has no yeast, thank God. There is no Candida. Most of the time you will see problems here. And then we don't have viruses, so great. So we are safe in terms of the virus. Then we go to, again, we'll see another high value of Entamoeba coli. Now, Entamoeba coli is it's something that most of you would have never heard about that. I mean, we do a lot of Entamoeba histolytica. We've heard about that. Amoebiasis and all that, but Entamoeba coli is high. So it just tells me that this patient has dysbiosis. This patient has a bad microbiome. This needs treatment. And so we'll continue how to treat this patient. And if you see the elastase here, when we talked about elastase, this is it could have been better, but this is fine. This patient does not have digestion issues. So the patient would have never presented with a bloating or constipation or diarrhea. This is a beta glucuronidase. This is normal. And then you see the IgA is low. So you can imagine now this patient has a bad defense mechanism. So in this case, we will be solving the issues of this patient. Now digestion looks okay. So no wonder the patient did not present with any stomach ailments. So the gut microbiome patients, bad gut microbiome doesn't necessarily always has to present with the gut symptoms. This is what I'm trying to correlate. So this patient has anti-gliadin IgA, which is high, and means patient is reacting to gluten. So when we treat this patient, we will be doing 5-hour approach. Now, all my friends and colleagues doing functional medicine are already aware of this 5-hour approach. And this is one of the best approaches I have ever used in treating a patient. First step, just remove everything that you think are causing the usual allergens. I like to remove, this is my approach. I like to remove all gluten, all dairy. So there is no yogurt, there is no buttermilk, nothing. And all forms of gluten have to be removed. Even the oats sometimes is, it's milled in the same place. So oats, gluten-free oats, if you can find, yes, great, but you remove all oats. There's still a lot to eat even after this. You make sure they eat organic foods, very hard to find, but we will definitely, we want to tell them to eat organic, and we give them phytonutrients. You have to remove the offenders. You have to go in the detailed supplement and medication history, and you have to remove the NSAIDs and the PPIs, and you have to remove, for removing the PPIs, the interesting thing is that when you just learn functional medicine, you just remove the PPI. Okay, go off the Pantocid tomorrow. You don't do that. You taper it. Because you cannot just ask somebody who's been taking, there are people who are taking, you'll be amazed to see people are taking this for 20 years, 25 years. So you cannot just tell them, okay, go off PPI. You know that they have low stomach acid now, but you will go slow. Of course, there's no calorie restriction when you put someone on elimination diet. Please don't do that. Please don't tell them to eat less, because when they eat less, they will get frustrated and they will fall out of the program and they will never get better. And of course, you want to make sure that when you do elimination diet, their relationship with food, their understanding of their awareness of the body, the food reaction becomes much more intense, and tell them to focus on that. Typical foods to avoid, these are the usual ones: chocolate, dairy, beef, eggs, peanuts, definitely no peanuts, shellfish, anything though that can trigger any immune response, you want to take them out of this. Foods to eat, there is a lot to eat. You can see that there is, it looks less, but if you actually expand it for the patient, it's a lot of food. What now replacement? Now replacement depends upon what kind of patient you're dealing with. I mean, are you thinking it's low stomach acid? Do you see the elastase is very low? Do you see that the patient has digestion issues? Do you know if the patient lactose intolerant? And when you know that the patient is also giving a response to the anti-gliadin, IgA, then you want to make sure that you put them on enzymes, because total avoidance of gluten in my practice has never been a successful idea, because there is gluten everywhere. It's even if you ask someone for a bajra roti, they're going to put some gluten, so you have to be very, unless the patient is very careful, you want to start substituting these. Betaine HCl, generally, I would start at a later stage. My first go-to is always cider. Second will be the Swedish bitters, but in India, we don't get them easily. So we can go with betaine HCl, but start slow, because you want to see the response. Betaine HCl, you don't want to just make somebody have gastritis by giving HCl. Give them a trial of 3-4 days. I give them from my office, and I give them a trial. If they do well and they feel good, they can digest proteins better, then yeah, we'll put them on betaine HCl every day. Bile salts we need, if somebody had steatorrhea, then we will use bile salts. Magnesium, iron, and zinc are going to be important for the gut function. Magnesium is important for many other functions, but most of the times magnesium can help move their bowels better and make them relaxed. Also, magnesium is a great element to be had for bone strength. Iron and zinc, um, we, I mean, depends upon whether we are we are healing the gut mucosa, we use zinc carnosine. Otherwise, iron is something you will find nutritional labs, low in some patients. Um, then re-inoculate, we give probiotics, prebiotics, as you all know. My favorite is symbiotics. I use combination of both. And for example, I will use inulin and bifidobacterium. But if you're going to treat a bad dysbiosis, the one I showed you, you want to use more than 300 billion CFUs because you cannot undertreat this. Patient can be popping probiotic, but if it's not good strength, there's no use. And don't forget to add Saccharomyces. But there's one pearl of wisdom here is that when you add Saccharomyces boulardii, I have seen patients getting worse. So because there is a strong response to these, and then when a patient responds and they feel unwell and they feel bloating and they feel stomach ache, you know that you started adding too fast. So I would do 300 billion CFU, but I would add Saccharomyces boulardii maybe a week later. So this is my experience. And then fecal transplant, of course, if somebody has a chronic C. diff, is going to fecal transplant is really a thing of research right now, not commercially available. Specific treatments of botanicals. So when the patient is coming to us, they don't want allopathic drugs. They don't want it. So if you're going to tell them, oh, I'm going to give you for H. pylori 4 drug therapy, for 3 weeks, 2 weeks, they kind of they don't like it, So you want to focus on botanicals because botanicals have lower side effect potential, not that they're completely free of side effects. And you want to use, for example, let's say H. pylori, very common, right? Explore bismuth. Now, bismuth is a great treatment. It is also used to be a part of the drug protocol long time back, but bismuth is very harmless. And I think one of the my major treatments for H. pylori is consisting of bismuth. And unless the patient has peptic ulcer disease, I don't go for the 4-drug therapy. You want to involve a gastroenterologist if someone has a PUD. Otherwise, I think this pretty much can be solved at the GP level. I also use rifaximin if there is a SIBO going on side by side. And then, of course, if the patient had if they had Candida, we will use, my go-to is nystatin. And if there is a parasite, if you see any of the tapeworms and stuff like that, I would use ivermectin. That's my drug of choice. Very, the patient does not feel bad. It's very well tolerated, and it's a short course. So these are my go-tos for treatment. And we talk about repair. So repair in autoimmune patient is going to be one of the most important steps. So I think everybody knows about glutamine. Glutamine is extremely great for repairing the mucosal layer. I do colostrum too. Colostrum is one of the best immunoglobulins. It has best immunoglobulins that you can give naturally to a patient. And aloe vera extract is easily available. I think people are growing aloe vera in our country in their backyards, so it's very easily available. You just have to tell them how to take it. And then this whole list of things that one of my things with functional medicine is, and other doctors, is when I give vitamin A, there is a big, hurrah around it. So don't be afraid to use vitamin A. I think people need to use vitamin A. Vitamin A can be really used in a good 10,000, 20,000, even more sometimes. And it can really benefit in the gut lining, and of course, essential fatty acids through food and B vitamins through food. Stress management is very important. We have to rebalance. Always involve a therapist. If you think the PHQ-9 has gone over 8, that's my cutoff. Sleep hygiene and exercise, of course, nothing exertional should be advised, because patients are already inflamed. If you tell them, okay, go for a run on start jump rope and stuff, then it's a wrong advice. So please tell them to use some yoga, Pilates, Tai Chi. These are, all you want is movement. You don't want exercise. So these are some extra things that these are important, but I had to put it in the end because, it's obvious, but we sometimes will forget in the whole list of things, we will forget the basic vitamin D. So do not forget vitamin D. And some antibiotics even the herbal ones, the botanical ones, will make rheumatoid patients worse. So you have to literally start a supplement by supplement, a day by day. That's why it's good to have them on a retainer. So you want to take care. And of course, you can do a TPC, very good for SLE patients. I don't know how many people use that. Then low dose naltrexone is one of my favorites and is always frowned upon and looked upon by my colleagues in the traditional medical world. But low dose naltrexone is extremely beneficial in autoimmune patients, and I have seen some amazing. I don't know if I will ever get time to publish something for that, but I have seen amazing results with low dose naltrexone, and these are some references. These are my important 4 things that please don't overtreat. Sometimes the gut microbiome needs what they have. The villains are okay to be there. Use supportive therapies. Don't go crazy about antibiotics. Don't start them on the flagyl and metronidazoles. And do not over supplement. Please do not over supplement. If you are going to give them 10 bottles of anything, they're not going to be sticking with you. I can tell you that. You don't over supplement. And what, 20 minutes are over? 24?
Yes.
25.
Okay, good. I'm done. This is my last. Please use food as medicine.
Yes, thank you. So we have a couple of questions here. I'll pick a couple of them for you. Can you specify specific fruits which should be avoided in gut problems?
All the high GI or anything that has high glycemic index. So I would say avoid mangoes, avoid bananas, avoid anything that has high sugar, anything overripe and high sugar. Although it's not the same for pineapple, because we know that pineapple has bromelain, so we will not avoid pineapple. But you have to understand, also remember the stem of the pineapple has bromelain, not the side. So if people eat the side, leave the stem. So so the basic fruits will be all berries are great, but our Indian patients don't have access to berries. So I would say anar is good, pineapple is good, papita is good, but don't do anything which is excess sugar, like custard apple and all. Don't do that.
Okay. Will curcumin mixed with MCT oil help such patients?
Yes. I did not mention curcumin here because for the simple reason that curcumin sometimes is misused. A lot of patients who have gastric issues, have acidity, somebody on a PPI, if you give them curcumin and you're tapering a PPI, you will find that they will get worse. So curcumin is to be used literally slowly. And of course, if you mix it with fat, it is well absorbed, no doubt. And MCT oil is, again, a great way to start a day, and case-to-case basis. And I think it's fine.
Okay. And what test would you suggest? A gut microbiome test or an oats testing?
Oh, okay. So oats, I think that the gut microbiome has a GI map and CSAP. I would like to do a GI map more than anything else, because it tells me a lot more about the gut integrity rather than oats.
Okay. All right. Okay. Thank you. That was a very informative session, Dr. Hooda. Thank you once again.
Thank you. Thank you so much.
Yeah. So we move on to our next speaker, Dr. Anshul Gupta. One major very common autoimmune condition today is Hashimoto thyroiditis. And in the conventional medical system, there is presently no solution for this. A thyroid pill doesn't address the autoimmunity. And in fact, 40% of the cases, in 40% of the cases, it doesn't help with the hypothyroid symptoms either. So today we have Dr. Anshul Gupta. He's the author of Reversing Hashimoto's, and he's on a mission to help 1 million people reverse their health conditions. Over to you, Dr. Gupta.
Thank you so much, Dr. Ruhi. It's a pleasure being over here. You guys are doing an amazing job. This conference has an amazing line of speakers, so I'm privileged to be here. So great. So let me actually start with my presentation. Just give me a second, guys. Okay. Here we go. So today, as we are going to talk more about Hashimoto's, okay? And then basically what I have learned about Hashimoto's and why this is one of the most mismanaged condition worldwide, okay? So that's what we're going to talk about. Today, you're going to learn about why people have unresolved symptoms of thyroid and Hashimoto's, and what are the triggers of Hashimoto's and what you can do right now to actually reverse your Hashimoto's conditions. So that's what we're going to talk about today. So thyroid disorders increasing rapidly at a very, very fast rate. Different names given to the thyroid disorders, whether there's hypothyroidism or Hashimoto's, goiter, thyroid nodules, Graves' disease, all of those different names given. All of them are not the same, but they're different names to the thyroid conditions that we see very commonly. Mainly, it affects the middle-aged females between 30 to 65. That's what we have traditionally seen. Now, actually, what we are seeing is that younger females are also being affected with Hashimoto's, as well as males are being affected too. So this is the recent change in the last decade that we are seeing, that more and more males, as well as younger females, are also being diagnosed with Hashimoto's. The worst about Hashimoto's or thyroid conditions is that it comes with a host of symptoms, okay? Like fatigue, brain fog, weight issues, hair loss, gut problems. So this is where, like most of the patients reach out to their doctor about, well, I have these set of symptoms and I feel I have a thyroid issue. And unfortunately, these symptoms keep on getting worse and worse and worse as we go along. And that's the unfortunate part about the thyroid, is that once you get these symptoms, even after treatment, most females do not feel better. Now, what is the conventional treatment? Now, all those conditions I showed you, whether you have hypothyroidism, whether you have Hashimoto's, or even if you have thyroid nodule, the only treatment with conventional medicine is basically giving you levothyroxine. Levothyroxine is a T4 hormone, which is a thyroid hormone, and that's the only treatment available. Doesn't matter why you have thyroid condition or what kind of thyroid condition you have, that's the only treatment available. There is no explanation given of why suddenly one day you develop thyroid. So the way kind of explained is that, let's say you go to a doctor, okay, well, you have diabetes, you have been diagnosed with diabetes. Now, when you ask, well, why did I get diabetes? And the doctor explains to you, well, it was because of your poor lifestyle. You were eating too much sugars or you were eating too much refined food. But when you go to your doctor and say, oh, well, I have been diagnosed with thyroid condition. Why did I get thyroid condition? And the doctor says, I don't know. Just one day, your body decided, okay, well, my thyroid is not going to work, right? So, and that's not true. And that's where the conventional medicine also fails, that they are not able to explain why a person is developing thyroid condition. The unfortunate part is that the treatment doesn't work. Even doing the levothyroxine, most of the people still continue to suffer from unresolved symptoms. So there has been a couple of studies done, and this one study over here was done in UK about thyroid patients, and they were looking at their symptoms even after doing levothyroxine treatment, and even though their lab results are perfectly normal, around 40% of patients still continue to have different kind of symptoms. And the worst symptoms that continued even after treatment was weight gain and fatigue. So fatigue was very, very difficult to kind of improve even with levothyroxine. So that was the situation that we saw. There was another study done. Actually, now it looked at the neurocognitive symptoms. So as I shared with you, thyroid disorders come with a host of brain symptoms where people feel brain foggy, they feel that their mental capacity is not the same, they're confused, or they have less of the attention span. Sometimes people have ADD or ADHD like of symptoms, that they cannot sit, like in one place or cannot do long hours of work. So they actually checked neurocognitive symptoms through different questionnaires as well as by testing. And what they saw was that even again after treatment with levothyroxine, symptoms did not improve. The neurocognitive symptoms stayed exactly the same. So that was again a very, very astonishing fact. So there has been more studies about it, but these were the two studies that I wanted to share with you to kind of show that just levothyroxine doesn't work, for majority of the thyroid patients. And that's the scary piece. Now, why is conventional medicine failing, right? Because I am also a conventional medicine doctor. I did practice conventional medicine for majority of my career. So then why is it failing? Why we are not able to help thyroid patients? So the strong belief in conventional medicine is that levothyroxine is the only solution, period. They are not looking for answers. They have a very strong belief that we have found an answer, which is the levothyroxine, and that's it. We don't have to look any further. They're not paying attention to the symptoms of their patients, and that's very unfortunate. What happens is that, like when the patient comes to us, we just write a whole bunch of tests, and then the test is normal, then the symptoms do not matter. Then we say that, okay, symptoms are in your head. Basically, you need to find a different doctor, or you just need to find a psychiatrist, right? We don't believe our patients, the conventional doctor. So that's very, very like a disappointing situation. Now, what does happen to the patients? They leave frustrated, they are angry, and they have no hope. Okay, well, this is the way probably I have to live this my whole life, and which is not true. So the question is that why are people with Hashimoto's not feeling better? Okay, and that's where I'm going to answer this question to you. So the reason actually the underlying problem in Hashimoto's is the destruction of an important connection, which is I call it as a mitothyroid connection. Okay, and this is what we're going to talk about today. What is mitothyroid connection and why is it broken? So let's talk more about it. So thyroid and mitochondria. So first of all, what is mitochondria? So mitochondria is a powerhouse of the cell. This is the way that we have known mitochondria for centuries. That, okay, well, mitochondria is the engine of your body. It produces energy and that's it. But the new research actually suggests that mitochondria is much more than powerhouse of the cell. It is now involved in aging. It is also involved in controlling inflammation. It is a very important regulator even in autoimmune processes. Even in dementia and a lot of chronic diseases, we see that mitochondria is actually the reason that we are developing them. Now, thyroid and mitochondria has a very special connection. Thyroid hormone regulates the function of mitochondrial health. It is actually regulated in mitochondrial genesis, even it controls the metabolic functioning of the mitochondria. Now, we see that it is a one-way connection. The thyroid controls the mitochondria, but it's actually a two-way connection. Mitochondria actually is also controlling or helping your thyroid because mitochondria actually regulates the oxidative stress that your body goes through. So what is oxidative stress? So oxidative stress is basically rusting of your body, right? There is iron which gets rusted when it gets exposed to oxygen, right? So your body also gets exposed to reactive oxygen species which are produced by a body day in and day out. And these reactive oxygen species starts harming your body from inside. Now, mitochondria is actually responsible for taking care of these reactive oxygen species. They are producing reactive oxygen species as well as removing from your body. So that's why if the mitochondria is not working, then your thyroid also doesn't work. Now, if we also look that, what are the main symptoms that are associated with Hashimoto's are actually because of mitochondria. Now, what is the pathogenesis of Hashimoto's disease? So Hashimoto's disease is an autoimmune condition of the thyroid gland. What that means is that your body is producing antibodies against your own body, which is mainly your thyroid gland, and it starts destroying it. Now, research shows that, the thyroid follicles, like the actual thyroid follicles, when they were able to see, the antibodies also lead to the destruction of mitochondria. Okay. So we are now able to, because we have more advanced technology, electron microscopes, we are actually able to look inside the cells of what exactly is going on. So what you figured out is that this ultimate destruction of mitochondria, these antibodies lead to, and that's where, actually the Hashimoto disease happens. So again, through electron microscopy and biopsies, what we saw was that there were a large numbers of dysfunctional mitochondria, which were found actually in people who have thyroid diseases. So they actually took the biopsy of people from normal people as well as compared to Hashimoto's. And what they saw was that they were much more dysfunctional or mitochondria, which was not working. So again, this kind of tells us that, okay, when Hashimoto's disease, the autoimmunity is leading to the thyroid destruction. But if you go much deeper, then it is actually the destruction of mitochondria, which is causing all this trouble. Okay. Now, the interesting piece is that, like the Hashimoto symptoms that we shared with you, like fatigue, like weight gain, feeling cold, brain fog, constipation, are actually all symptoms of mitochondrial dysfunction. And that's the interesting piece. Like if you go into the research about it, you will see that mitochondria is a reason of all these symptoms, because mitochondria is a powerhouse. Mitochondria regulates your temperature. Mitochondria is involved in brain functioning. Mitochondria is involved in heart functioning, your gut functioning, your hair functioning. So all of those things, like which are not working are because of poor mitochondria. The traditional medicine thinks, well, the mitochondria is not working because people are just low in thyroid hormone. And that is not true. If it was true, then if you give the thyroid hormone, then the mitochondria should be happy and they should start working. But that's not the case, because it's actually the antibodies which are destroying these mitochondria. It is just not a deficiency of thyroid hormone in Hashimoto's patients. So that's exactly, like I was talking about. So levothyroxine doesn't work because we are not doing anything to work on the underlying process, which is the antibodies, which are destroying this mitothyroid connection. We are just pumping people with more and more thyroid hormones while we are not addressing the actual problem, which is there. So now let's talk about, okay, well, why is this mitothyroid connection broken? Like, okay, well, now we understand the underlying problem is this mitothyroid connection broken, but why is it broken? Again, this question, why did I develop this, like Hashimoto's problem? So now the research suggests, like that, why do we develop Hashimoto's? So Hashimoto's is an interplay between your genetic makeup and environmental factors. Okay. And that's what again, time and again, research has proven it. Okay. Now we cannot change your genes, right? Because yes, there might be some conditions which live or which go into your genetic makeup, but it's the environmental factors which trigger your Hashimoto's. And that's what we can control. And that's exactly, if we control those environmental factors and we work on them, then we are able to reverse Hashimoto's most of the time. So what are the triggers? What are the triggers which is destroying this mitothyroid connection? So I have 5 different categories of triggers. One is the food sensitivities, then there is nutritional deficiencies, then there is trauma or stress, then there is toxins, and there is infection. So these are the main triggers that are destroying these mitothyroid connection. Now let's talk about food sensitivities. Well, why are we developing more and more food sensitivities, right? Because people will say, oh no, this is also very important to know that food sensitivity is different from food allergies. And they're not exactly the same. Food allergy will be, you consume peanuts, you blow up like a balloon, and you land up in the emergency room. That's food allergies. Food sensitivity is that you consume a certain food like gluten. Your body says, hey, gluten, I don't hate you, but I don't like you either. So they start producing antibodies at a very, very low level. And then chronic exposure to these antibodies leads to the destruction of our body. So the bigger question is that why are we developing food sensitivities? The reason is that our food is changing rapidly. Now, our food also has a genetic makeup, right? And food also has a cell structure around it. So over the course of the last millennia, our body has recognized food by different ways. Now, with obviously the advent of, like the new technology, our food has been changed. A lot of GMO foods have come up. We are changing the way we are growing foods. So our body is not able to keep up with the change in the food. And that's the reason our body is developing more and more sensitivity. So the common foods that we are sensitive to is the food which has been changed rapidly, like dairy, like gluten, corn, soy, sugar, processed food, even caffeine. All those foods, I've seen that, people with Hashimoto's are sensitive to. And that's where can be a big, big trigger of Hashimoto's. A systemic review was conducted of 12 different research studies, and they saw that people who have a thyroid disorders have high chances of celiac disease. Now, celiac disease is where you are actually allergic to gluten, which is the worst form of like the gluten allergies, right? And unfortunately, as we do not have a perfect test to check for gluten sensitivities, then that's the reason we don't even have research studies. But if we have research studies that prove that there is association with thyroid and gluten and celiac disease, then definitely gluten should be considered as a problem in Hashimoto's. Another study was done which shows that there is a positive correlation between Hashimoto's antibodies with consumption of animal fats and butter. Now, obviously, like there is a big question about, there is a big push about what kind of animal fat and people were doing. So obviously in this study, when the people were enrolled, most people were using more about the processed fat or processed meat, animal meat. Obviously there is a big cause or a big, a push that where animal fats, like red meats or other meats could be helpful if they are grown in a good, like humane way. But these research studies again show that the food sensitivities are a very important issue with thyroid problems. Now, the second, is trauma and stress. This is the one thing which is always discounted. People don't even kind of want to address this big issue. So what, we have seen is that a lot of people, when they get diagnosed with Hashimoto's, a year or 2 years before that, they have been gone through a stressful event. Whether that is going through a difficult relationship or a divorce or work issues or major health issues or even pregnancy. Post pregnancy, there is a big spike that we see in Hashimoto's patients. So that's a very big issue that we see. Again, I'm not saying that nobody should get pregnant, but I'm just kind of putting the facts or the figures in front of you that even pregnancy can trigger Hashimoto's.
Dr. You have 10 minutes.
Oh, okay. So we'll just go a little bit faster. So yes, the second thing is the third category is toxins. So our environment is loaded with different kind of toxins, heavy metals, like mold toxins, environmental toxins. So that can be a trigger. Again, research, I just shared some research studies over here. There are tons more studies again showing that mold toxins can cause Hashimoto's. Here we are share that pesticides are developing Hashimoto's. So, like that is again thing. Okay. Then infections. So this is also an important trigger that we see in Hashimoto's patients. Several people get exposed to different kinds of infections that we have, like whether Epstein-Barr virus, whether Lyme disease or parasites in our gut, food poisoning, all of those things can trigger Hashimoto's. And again, research studies proves that Epstein-Barr can get reactivated, can cause Hashimoto's. Okay, so now what is the three-step process that I want to kind of share with you that you can reverse Hashimoto's? So the very first step is identifying the trigger. So I kind of shared with you the main big 5 categories of triggers. So that's where you need to start looking at those. Now, often what happens is that people do not have just one category. They have multiple categories of triggers. They might have poor food habits, and then they might also be get exposed to toxins, and they might have infections. So it's very important that we analyze all the triggers. And that's where working with a functional medicine doctor is very nice, or an integrative medicine doctor who have access to those advanced testing, because the regular tests, like through our conventional labs, are useless. They are not able to identify the triggers. So doing a food sensitivity panel, doing gut analysis, like about from GI maps, and also looking at OAT testing as well as looking for toxin testing. So those are the tests that we should have available, or we can do on our Hashimoto's clients to know what triggers we have. Now, then step 2, what we start doing is that we start fixing this mitothyroid connection. So for that, I made this special diet, which is called mitothyroid diet. Now, interestingly, we have different kinds of diets available in the market. An autoimmune diet or a paleo diet, or a low FODMAP diet, but we don't have very specific diet for Hashimoto's patients. Most of us are using an autoimmune paleo diet, but I wanted to make sure that, we also introduce foods that are good for thyroid. So the principles, there are 3 principles on this mitothyroid diet. First principle, remove foods that are causing damage to your mitothyroid connection. And as I shared with you, those are sugary foods, processed food, trans fats, gluten, dairy, soy, corn. So all these foods needs to be removed so that we stop the damage which is happening to the thyroid gland. The second principle is start adding food which start repairing this mitothyroid connection, and which includes good fats, high quality proteins and nuts and seeds. And the third principle is using antioxidant foods. The antioxidant food, like which also again helps to reduce inflammation and stop this destruction of the mitochondria and thyroid. Again, green leafy vegetables, only limited number of fruits and also gluten-free grains. So why do you need to remove all these foods? We already discussed because of the food sensitivity panel, so I'm not going to spend more time on it. Good foods, so good fats. What are good fats? So olive oil, coconut oil, your ghee, your avocados and fatty fishes. Those are all good fats. So again, we should include those, to start fixing the mitochondrial connection. Good quality proteins, fish, chicken, nuts and seeds, beans. Again, you don't have to be a vegan, you don't have to be vegetarian, or you don't have to be just meat eater. Okay, just good quality protein. Doesn't matter whatever your belief system is, you can do this diet even then. Nuts and seeds, very important thing. Chia seeds, flax seeds, almonds, walnuts, wonderful nuts and seeds that you should introduce into your diet. More good foods, non-starchy vegetables. Now, a lot of people have been told, by their traditional doctors, okay, don't eat, like a lot of vegetables. Stay away from those goitrogenous foods. Again, a very, like important myth to consider. The research that was done that proved that these can be a goitrogenous food or might be harmful is at least 30 years old research study. There has not been a research study done in humans which prove that those food are bad. Actually, the new research studies prove that those all foods are actually helpful, because 30 years ago when we had thyroid problem or like which was mainly iodine deficiency, but now it's opposite. The main reason of thyroid problem currently is Hashimoto, which is an autoimmune condition, and all these non-starchy vegetables are very important for improving your thyroid and Hashimoto's. Fruits, again, very limited fruits, like as I said, blueberries, blackberries, strawberries, apples, which is again low glycemic index, and gluten-free grains, quinoa, oats are the best ones in that situation. So this is just a case story. I think we might just skip it, in terms of the time, which again was a female who came with like issues with Hashimoto's, and she has done several different diets, which are mainly focused on calories, which is the traditional way of looking at nutrition. But this diet is mainly focusing on quality of food. And within 3 weeks, she had huge change in her body, and obviously a lot of her things got better. So the message in this mitothyroid diet is very simple. Don't just focus on the calories. Instead, you have to focus on the quality of the foods. That's the main key. Okay. All right. Now, let's talk about some of the supplements that can help with the thyroid and the mitochondria. So zinc, very important supplement, which regulates your immunity, important for thyroid hormone production, as well as conversion of your thyroid hormone from an inactive T4 to T3. Different forms of zinc, again, research studies have been done. So there are two forms of zinc, like zinc glycinate and zinc picolinate. Those are the ones which are the best absorbed form of zinc. 30 milligrams daily is good enough of the dosage if you're taking these ones. If you're taking zinc sulfate or something else, then you might have to take a higher dosage just because they are poorly absorbed. Very important supplement, zinc, everybody knows, especially in COVID, this is a supplement everybody's taking. Selenium, again, a very important supplement. Research now shows that our food is actually deficient in selenium. So even though you're eating the healthiest of the diet, our soil is deficient in selenium. And that's the reason we have to supplement with selenium from outside bases. Again, different forms of selenium are present. Selenium methionine is the best form out of it. Dosage, varies between 150 to 200 micrograms daily. Selenium is again important for thyroid hormone production, reduces inflammation. So very important supplement with selenium is there. Selenium, the research, there has been at least 10 different research studies done, which proves that after supplementing with selenium, the thyroid antibodies go down. So one of the most important supplement that anybody with Hashimoto should take. Magnesium, again, an important supplement, like which again, almost everybody takes now these days. Different forms of magnesium are there. Magnesium citrate, magnesium glycinate. If you have people with constipation, citrate is a better form. If you have if you don't have constipation, or if you have the opposite problem, then magnesium glycinate is the form to use. Again, magnesium is important for helps with iodine uptake in the thyroid gland. It also helps with reducing the oxidative stress. So as I explained to you that the major reason or the major problem in Hashimoto's is causing inflammation, which is destroying the thyroid. So magnesium is very important regulator for your autoimmune process. 300 to 400 milligrams daily is magnesium. The good part about magnesium is that, you can use very high doses if you have to. There's not much downside to it. We use a high dose of magnesium even in the emergency room all the time, right? So that's one of the safest supplement that you can use. Vitamin B12, again, a lot of people are deficient into it. Again, research studies do prove that people with Hashimoto's have also a condition called pernicious anemia, which again doesn't let your B12 to absorb. So very important to know that, okay? Because if you are taking vitamin B12 supplement, they might not be getting absorbed in your patients. So you might need to use a sublingual form or even injectable form. So very important. And again, testing for B12 is again a controversial thing. So regular tests, just a blood vitamin B12 is not enough. So you have to check all different methods like MMA level, which is a methylmalonic acid levels. And sometimes you can check other indirect markers like homocysteine levels. And then you make a determination whether the person is insufficient or low in vitamin B12 or not. Because a lot of symptoms of vitamin B12 actually are thyroid symptoms also. So it's very difficult to know just based on symptoms. Sublingual form, 1000 micrograms daily is good enough. Injectable, again, you can do 1000 micrograms for a week, and then you can go on a monthly basis for that. Vitamin D, again, very important supplement that you should be using. It regulates your inflammation, helps with thyroid health. All the autoimmune diseases, there are tons and tons of research studies which show vitamin D is great. Unfortunately, everybody believes that we are getting enough vitamin D by getting exposed to the sun. It is not a reality. It matters a lot, and we are actually clothed from head to toe. We don't go out in the sun naked, right? So our body doesn't get exposed to vitamin D. So it's almost each and every patient is deficient in vitamin D. So very important to supplement it. Again, 5,000 international units is good. You can do your levels, easy test to do on the blood test, and that will tell you how low is vitamin D, and you can start at a higher dosage also.
Dr. Gupta,
CoQ10.
open for questions.
Okay. Do you want, so I will just go over this real quick, just for a second.
Sure.
Okay. So CoQ10, another supplement, you can look at the dosage over here. And the step 3 is basically removing the toxicities, which is working on the stress, working on toxins and infections. Okay. So stress management, very important. Make sure your patients are doing it. Detox, very important. But again, you need to know what you're detoxifying and how you're doing it. Okay. So work on the detox and the boost the immunity, very important. Anti-inflammatory diet, which is a mitothyroid diet, your good quality sleep and some supplements. Okay. So this is basically the 3-step process, which is, which I've helped thousands of patients. If you do this, all of your Hashimoto's clients are going to get better. Everybody is going to feel better. Okay. So there is light at the end of the tunnel, so you can feel better. There is definitely hope. All right. Now we're open for questions.
So Dr. Gupta, what's the role of soy and iodized salt in Hashimoto's?
Soy and iodized salt?
Yes.
Okay, so there are two different questions. So iodized salt. So iodine is a controversy right now. So initially Hashimoto's was caused because of low iodine, but now the new research again proves that even high levels of iodine can also cause Hashimoto's. So we have to be very balanced in terms of that. So that's the reason iodized salt is fine. You can use it. But like if you take other forms of iodine supplements, or if you have other foods which are high in iodine, I prefer that. There are different kinds of salt like Himalayan salt, or sea salt, but they are not high in iodine. So you just have to make sure for that. So iodine is a double-edged sword. So you have to be careful of having low iodine as well as high iodine. The next question about soy. So as I said, like soy, majority of the soy across the globe is GMO soy. And GMO soy, it's very, very harmful for the body. And that's the reason we try to avoid it. Now, some of the soy, which is like fermented soy, like tempeh and miso soups, which comes from Japan and all those areas, they might be okay. But, like the regular soy is really bad. So that's the reason, like we try to avoid it.
And does heavy metals play a role in Hashimoto?
Oh, absolutely. Yes. Again, like we did not have the time of the toxins, but there are research studies of mercury, lead, which again proves that, they cause Hashimoto's. Lead actually accumulate, lead and mercury has a very high affinity for thyroid gland. So even very small doses of exposure directly go to your thyroid gland, gets deposited over there and leads to Hashimoto's. It's very important that, you check for heavy metals, especially in Indian scenario, we are heavily polluted our Indian soil with lead. So a lot of our spices and a lot of our food is actually high in lead. So make sure that you're checking for lead, very, very important.
And apart from Brazil nuts, what are the other sources of selenium-rich food?
That's again unfortunate part that, our selenium, like there are not many good foods which are high in selenium, especially for vegetarian foods, like for non, like, especially people are eating meat, some of the seafoods and other things might have some selenium, but otherwise we don't have much sources. So that's the reason I always go with supplementation of selenium rather than, like relying on the food. Because again, there was a research study done comparing food from 1990s to 2000, and they saw a drastic decrease in selenium levels in food itself.
Right. And doctor, you talked about iodine. So are there tests which can be easily done to test the iodine levels?
That's another big problem. There are different tests, but none of them are reliable. So there is a blood test to check for iodine, there is a urine test for iodine, and there is a 24-hour urine test for iodine. Out of these, 24-hour urine test is the most reliable, but even then, it can vary depending on your body structure. So the short answer is that there is not a foolproof test for iodine, but there are several tests that you can check and at least gives you an idea. But just remember that they are not foolproof.
Sure. All right. Thank you. Thanks a lot. We'll move on to our next speaker. So hidden chronic infections are a major reason behind the rising autoimmune conditions. And ozone therapy is one tool which can really, which has a very good effect when it comes to antiviral, antibacterial, antifungal detoxification. We have today Dr. Mili Shah. She's the president of Ozone Forum of India, an expert and educator of ozone therapy. Over to you, Dr. Shah.
Thank you, Dr. Ruhi, and thank you, Dr. Preeti, for inviting me for this conference of Indian Association of Functional Medicine. We've been promoting ozone therapy for the last 18 years, and I'm really happy that today we can share some of the knowledge of ozone therapy with all of you. I'll just start sharing the slide. Anytime, Dr. Ruhi, you can tell me to stop whenever you have that time limit. Otherwise, I'll keep going on. Okay. Are these slides visible to you all?
Yes.
Okay. So integrating ozone therapy in natural wellness and gut health. So of course, gut health is very important, but the natural wellness which you can get by a natural molecule like ozone and oxygen, that's the most important aspect of treatment. And we are doing chemical-free pro-drug therapy. So this is not a pharmacological drug. It is a pro-drug which helps you in bringing down your oxidative stress and improving your immunity or modulating your immunity. So to use ozone therapy effectively, you need a small shift from a compartmental treatment. You have to go to a broad spectrum and look at the patient as a whole. And the most important part towards improving better immunity, as we all know, the good nutrition, sound sleep, enough water intake, regular exercise, but we overlook proper oxygenation. This proper oxygenation is most important. It's a link between, as we also, when we talk about yoga, the breath is the link between your body and the mind. You need to have this harmony, and this proper oxygenation is very important, and that's where we come into. Many times patient does ask us, why do we need something like oxygen therapy? Why do we need, what is the use? The main thing is our body is breathing, but we are not utilizing the oxygen. So we are deficient in oxygen utilization. And this deficiency of oxygen utilization, there are many common symptoms like hyperacidity, bacterial viral infection, brain fog, circulatory problems, sudden cramps, feeling low. After a little exertion, you feel a little low, not up to your work. So chronic fatigue syndrome. These are all basic symptoms. These are symptoms, not the disease, of low oxygen utilization in your body. And you can correct this low oxygen utilization. But what are the causes of this low oxygen utilization is, I think this is very familiar to you all, that you need to see the elimination diet. You see what is affecting you. You have to improve your immunity. You have to optimize your hormones. You have to dampen the inflammatory processes. But in this whole, the most important is detox and rebalancing oxygen. And here we come with ozone therapy. It's a medical oxygen therapy, which is a combination of oxygen, which is 99.5% to 95%, where ozone will be 0.5 to 5%. Now, this is a double-edged sword. It gives oxygenation and oxidation. Oxygenation or antioxidant stimulation to your normal cell, and oxidation to the lower life forms or the faulty mitochondrial decayed cells or the damaged cells, degenerative cells. So when you do ozone therapy, it activates your cellular metabolism. Now, we all know that when you are diseased, you have anaerobic respiration when you have, which generates a lot of acidosis. At the same time, there is less ATP generation. We try to balance that. We will come to it, how it works slowly. Or it modulates your immunity. So we neither stimulate nor suppress. The ozone therapy, when you give, it upregulates your cytokines both, pro-inflammatory and anti-inflammatory, which kind of balance each other. And when you have a balanced immunity, you have the best modulation of the immunity. And it improves or regulates your antioxidant defense mechanism. Now we have a lot of extracellular antioxidant defense mechanism, like your multivitamins, like your minerals, like your liposoluble antioxidants. But where is the intracellular antioxidant defense mechanism? The idea is to improve your intracellular antioxidant defense mechanism, which is superoxide dismutase, catalase, glutathione reductase, and peroxidase. And when you have a harmony of these intracellular defense mechanism, you can fight against any oxidative stress. Ozone therapy stimulates your intracellular antioxidant defense mechanism. When we practice ozone therapy, we have very clear rules, very set rules. First of all, we never do any harm to the patient. And that's the important message which I want to, before you do anything, primum non nocere, don't do. Always treat the root cause. Now, there are many different root causes, and look at or take a good history to find the root cause, which is very common, which is very important for functional medicine as well. And we always go into escalating dose. So we don't start with a very high dose. We always go start low, go slow is our golden rule. We go steadily upwards and we try to improve patient as a whole. So ozone therapy, we use it in different diseases. Why? When you look at the slide, you may say that, wow, it can be used in multiple diseases. The key is that it improves your oxygen utilization and it reduces your oxidative stress. And the many diseases come into the broad spectrum of inflammatory conditions and oxidative stress conditions. So from eye disorder to the health and beauty, we can do everything. Eyes, allergies, immunity disorders, liver diseases, bowel conditions, viral, circulatory disorders, skin injuries. We treat multiple patients for their disease. We also treat them for anti-aging. We also treat them for improving or making them more efficient. So it can be used as a preventive tool, also for the treatment tool. In our clinic, we are based out of Mumbai, which is in Andheri. Our clinic, we treat multiple disorders. But nowadays, we see that there are a lot of patients which are coming for autoimmune conditions. And that's where today we are going to focus on gut health and autoimmunity. So the main biological properties of ozone therapy, that when you give ozone therapy, it increases your oxygen metabolism with the RBC mechanism. It improves your metabolism by generating more ATP. So it has metabolic regulator. Immunological modulator that balances your immunity, neither suppression nor stimulation. It's a very powerful natural germicidal property. So when we take antibiotic, we have a chemical overload, though it causes other side effects. But when you do ozone, you get natural antimicrobial. And we will come to it, how it works on it. And it balances your iconocyte synthesis and reducing the thromboxane A2. The different treatment, we use use of clinical ozone would be with modulation of red blood cell metabolism. It improves oxygen supply. You can use it in all arterial diseases, arterial circulatory diseases. Modulation of immune cells can be used against infection to improve your immunity and phagocytosis. Also, we use it at autoimmune condition to balance the immunity, to modulate, and it reduces the inflammatory processes. At the same time, we use this for anti-aging, aesthetic, and rejuvenation. So ozone works as a holistic treatment. So with the effect of RBC, ozone improves your heme oxygen curve. Heme oxygen curve is improved by 2,3-DPG formation, which improves delivery of oxygen at the tissue level. And it gives the beautiful antioxidant stimulation that when you're working with RBC, it stimulates your glutathione reductase and peroxidase, which balances your pentose phosphate cycle. So when you have a balanced pentose phosphate cycle, you have highly super gifted erythrocytes, which function at the prime level. So it's like a combination. With RBC, you get more oxygen. At the same time, you are balancing your antioxidant defense mechanism. By balancing your antioxidant mechanism, we are balancing or reducing your oxidative stress. And this is the beauty, that though being a powerful oxidant, single reactive oxygen molecule, this also will help your antioxidant defense mechanism. Ozone is a very powerful bactericidal, virucidal. Why? The singlet oxygen which releases, once you give ozone therapy, it will dissociate into O2 and a singlet oxygen. This singlet oxygen has an affinity towards PUFAs, aldehydes, and it dissolves in plasmatic water. When this comes in contact with any lower life form, like bacteria, virus, and fungi, they have a phospholipid bilayer, and inside they have chromosomal and there is nucleus. There's no mitochondria in any bacterial cell. So ozone goes and penetrates into the phospholipid bilayer and disintegrates the capsule or the envelope of the bacteria. That leads to destruction of the bacterial cell wall, and that stops the multiplication of your infection. So it's a natural antibiotic which works beautifully inside the body with a very smart. If it comes in contact with natural cell, it will stimulate your antioxidant defense mechanism. And if it comes in contact of lower life forms, it will disintegrate their capsule. So it's a very smart therapy. I will call it a very, key differentiating therapy, which can improve your general health also. Now, it's a little detail that how does it work? So when you do high dose of ozone therapy, we have down regulation of response to viral protein. We have down regulation of type 1 interferon protein signal, and regulation of the viral genome will be done. That is when you do ozone therapy. But there will be upregulation of immunocell recruitment. So your immunity will become at the prime. It can do phagocytosis in primary or in a better form. Antibacterial response will be given. It improves your cytokine protein receptor and it reduces your inflammatory protein. So when you give ozone therapy, it gives you holistic in down regulation of anti-inflammatory response and up regulation of the immunocell recruitment when you do. That's why we call it ozone therapy works extremely well as antimicrobial therapy. Now, these are the few slides which I can say Borrelia and infection on the slide, on your microscopic slide, you see that they are present. After ozone IV saline, you see they're completely absent, disintegrated. This is a slide for candida infection where you see the candida overgrowth in the slide. After ozone therapy, you see the platelets have been separated and this candida has regressed. It has reduced. This is the fungus and mold infection. When you see it under microscope, it has a huge development of these, or the colony development of the fungal growth, whereas post-ozone, you see that the growth has reduced and it has fragmented. So these are the microscopic evidence of how ozone helps. Also, ozone can be given on immuno. So with WBC's mechanism on ozone, with ozone therapy, ozone has induction of cytokines, interferons, and interleukins and growth factors. So this enhances your immunity, Th1, and Th2. So both have been primed, which balances each other. Like say, when you say IL-10 is anti-inflammatory, IL-6 is a pro-inflammatory, both will be balanced, the ratio is balanced, and they improve or has better autoimmune correction. So in short, when you give ozone therapy with WBC, it gives priming to monocyte and lymphocytes, which home in the lymph organs, which finally leads to release of cytokines, interferons, TNF, tumor necrosis factor, interleukins, and transforming growth factors. This enhances your humoral and cell-mediated immunity together. So how does ozone help in autoimmune condition? Now, I am the big fan of nutrition. I also am a big fan of elimination diet, but you need something which balances your autoimmune condition. Here, ozone therapy, which is a forgotten oxygen, which is a forgotten nutrient, can be coming in the picture. It activates your antioxidant defense mechanism. It enhances interferons alpha and beta, gamma, interleukins. It has the balance between pro-inflammatory and anti-inflammatory, and upregulates or improves your disbalanced immunity. So in general, ozone works in the autoimmune condition by immune modulation. There are different ways of using ozone therapy inside your body. We have more than 16 different applications of ozone therapy. But today we will look into a specific application which works on a gut dysbiosis. Now, what do we use as a protocol? We use protocol which eliminates waste, regenerates your liver, reactivates or restores your mineral hormone balance and antioxidant balance. So we advise rectal insufflation. It is a retention enema of oxygen ozone mixture inside the rectum. Very simple, very easy, no pain, and easy to do. We also put forward ozonated water, which works on gastralgia, gases, peptic ulcer diseases, and also in improving your digestion. Minor auto works as an auto vaccination to your body. So we take the blood and re-inject the blood plus ozone inside the body, which generates your cell type antibodies. So it works in combination. And if there is a pain along with it, we use some local injections.
Dr. Mili,
so what is, yes, I have 10 minutes.
8 more minutes.
Pardon?
8 minutes, Dr. Mili.
Yeah, I will finish it. Don't worry. Thank you. So rectal insufflation works extremely well locally as well as systemically. So when you give rectal insufflation, the blood supply of the rectum, which is mesenteric vein, absorbs ozone, gives to the portal vein, and straight leads to the liver. So by doing nothing, no IV, no medicine, you are regenerating your liver and improving your gut. At the same time, it sees the improved oxygen content in your jugular and in your portal vein. So it upregulates oxygenation. You are bypassing your lung for oxygen. You can go other way around and improve your oxygenation and oxidation. Ozone has, so rectal insufflation has upregulation of antioxidants. Also, it is very good for bactericidal or a large population of rectal anaerobic bacteria, which is firmicutes, bacteriocutes, and the proteobacteroids. Now, firmicutes is what causes the disbalance in your body. Ozone works in reduction of that, also has balance and regulation, immune regulation, though it improves your well-being by GALT activation and lymphatic system. Ozone therapy can be used for IBS, can be used for any constipation, which can be used on multiple gut-related conditions. And the target of ozone is anti-inflammatory and disinfectant. So it works as on a large condition like candidiasis, dysbacteriosis, and at the same time, it works on your constipation, liver, and hemorrhoids and fistula. So, and this is the published paper from Italy. There are many, but I didn't want to have, so much this thing to put in. The use of ozonated water and rectal for intestinal dysbiosis and showed fabulous results in was in few 21 sessions of rectal and water consumption. So if you want, Dr. Ruhi, I can stop here. The further was only few of the research papers which we have published. I am okay to take uh, questions if there are, or according to you, tell me if you want me to complete the presentation.
You have 5 more minutes, Dr. Shah. You can continue.
Thank you. So few of the research. Now, what we do when you want to improve immunity during COVID-19, we wanted to help we work from Bisleri Water Company. We are a Bisleri Charitable Trust initiative, Ozone Forum of India. So we worked on 2 modules. We gave ozone therapy and nutrition. And this study was published in European Journal of Pharmacology. We treated 320 employees of Bisleri with B12 and D3 rebalancing and ozone therapy as an antimicrobial injection, which generates the cell type immunity. Now, out of these 320 employees, over 9 months of the treatment, so the treatment was done for 3 months, but we observed them for 9 months. Only 7 of them out of 320 got infected for COVID-19. So it showed very good results in improving their immunity towards this pathology. I mean, they did not catch infection. So it showed a beautiful result of improving immunity. This was presented, Immunity Prophylaxis with Ozone Therapy. It's a review article. We did many CTRI trials for COVID-19, which improved the early RT-PCR negativity. At the same time, it had beautiful improvement in the symptoms. So all the symptoms for the COVID was also improved. So it had better immunity. Post-COVID traumas were controlled with ozone therapy. And this is the resolution of pneumonia with saline trial. You see the ground glass opacity, a lot of fibrotic changes, which on day 10, it had really reversed very well. We treat a lot of tuberculosis patients. MDR-TB is the most important burning issue of our country. Ozone therapy helps in improving, reducing the resistance in the antibiotic. At the same time, we improve their well-being. And this was also published in Journal of Immunopharmacology, where we saw the antioxidant enzymes like SOD and glutathione reductase were improved in MDR-TB when we had treated them for 30 cycles of ozone therapy. This was also published. Now, the observance of the patient, what we saw was improved appetite, weight gain, quality of sleep was also improved, joint pains were reduced. Feeling of well-being is bonus. So whenever you take ozone, you can be really happy, like Dr. Preeti. Okay, you can see psoriasis. As we see, it's an autoimmune condition. You see the dramatic change in the skin. Also, the uplift or confidence of being or facing people have improved. Herpes zoster, which is an infective pathology, in 15 sessions of ozone therapy, we saw dramatic healing with ozone therapy. This is again a herpes simplex. The drastic reduction is there. Verrucas were also improved very well after 15 days of ozone therapy. Now, what do we do? So with ozone therapy, we resuscitate the function of what has gone wrong. Immunomodulation, hormonal there. So from a destroyed Cadillac, we can become a nice looking, anti-aging, body. So this is just a, phrase to put in. We have a lot of science behind this. You can use ozone therapy for pain management. We use it in integrated oncology, tuberculosis, non-healing ulcers. And this is our clinic address. Let's energize the life with active oxygen. And thank you. This was our conference in 2019. Post that, we have not been able to do physical conference, but soon I think when if it becomes better, I would like to invite you all for that also. We will keep you posted. Thank you. And any questions I'm open to take. Thank you.
Thank you, Dr. Shah. We
I
have
hope I completed in time.
yes, yes. We have a couple of questions. So typically, how many ozone sessions does one need, and for how long is it spread over?
Okay, so typically, if you want as an anti-aging if you're perfect, you just want to improve your inner mitochondria, you have to boost your antioxidant defense mechanism, you need 10 to 15 sessions. If you're deceased or if you have any active condition, it all depends upon your reports and your, disease which you want to treat, anywhere between 20 to 30 sessions. If we are doing non-invasive treatments like rectal, can be done every day. But if you are doing invasive treatment, then I would do it 2 to 3 times a week.
Okay, so yeah, there are questions like, how can it help with deep vein thrombosis or coronary disease, liver cirrhosis, autoimmune conditions? So again, that would vary, right? How many sessions would be needed?
It all depends upon patient's condition. But whatever diseases like deep vein thrombosis, the problem is the thrombotic, or so the ozone improves collaterals. It improves your circulation. So it will help you in deep vein thrombosis, arterial circulatory. So we don't cause any chelating. What we do is we enhance oxygenation. So it works more on improving your regeneration of the collaterals, or improving your well-being, and making your cell wall. So ozone also has nitric oxide stimulation, works as a vasodilator. So it improves your circulation in that fashion also. Liver cirrhosis will definitely help, as I was talking about rectal, which from the rectum we straight away leads to liver. So it can have a beautiful, improvement in cirrhosis also.
Okay. And what's the age for rectal insufflation?
From 3 months, anytime. From the small baby to the oldest 90-year-old or above, you can use it. Ozone is extremely good in autism to improve gut-brain axis. Ozone is extremely good for cerebral palsy because the main problem is ischemia to the cell. Ozone tries to reverse the ischemic destruction. So you can use it as early as, I have seen the youngest patient, which was 8 months, which had a delayed milestone. And today that child is going to a normal school. So we've seen patients as young as. It all depends upon the weight, and the dosage is decided according to that.
Okay. And what's the role of ozone therapy in cancer?
Oh, it's a huge, I personally have worked with an onco-radiologist in 2007, 2008, where we published the first research in India from ozone therapy in radiation patients. Ozone therapy, now radiation and chemo, why are they not functioning? Because the cells have so much of lining that they do not allow any medicine to go in. Where the lower life forms of cancer do not have antioxidant defense mechanism. What they use is glucose for multiplying. When they come in contact of oxygenated ozone intermediate products, their challenge of glycolysis is challenged. And it also infiltrates the capsule or the phospholipid bilayer of this lower life form. So ozone therapy works very well as an integrated therapy. There are many patients who take ozone therapy. If you come to our clinic, we have many patients like that. I've been on an advisory board of a tumor clinic in Mumbai also. So we work on patients as a protective, preventive, and also people who are declined by conventional therapy. We try to give them quality of life. We try to give them like a palliative care also. So it all depends upon what is the patient and what can we do for them. But I don't claim that it can cure cancer. So I am very open, and I don't put them into false hope that, yes, I can reverse your cancer. No, I don't do that. I am very clear that whatever you do, I help you and you will be better.
So one last question, doctor. Is drinking of ozonized water, any good?
Of course, extremely good. So you see, we are a part of Bisleri Charitable Trust. So if you see a Bisleri bottle, the first thing it says is ozonated drinking water. Okay, why? They use ozone for every stage of purification, from the bottle to be purified, everything. Drinking ozonated water can have better digestion, can have less gas, improve your gut dysbiosis, no constipation, your detox is perfect. Your liver can excrete all the liver and kidneys are readily excreting all the toxins. So it gives you wonderful. And here, this ozonated water, you can make it at home. Otherwise, you have to go to a doctor for the therapy, but you can have ozonated water making machine, which takes the air as a feed gas, makes ozonated ozone, and you can bubble that into your portable drinking water and drink. You can have 1 liter to 1.5 liter of ozonated water. Over a period of time, you see dramatic change in your digestion. And if your absorption, if your digestion is better, your absorption of mineral is better, everything is better. So, so as we say, everything together starts with the gut. Heal the gut, you can get the better results.
Absolutely. All right. Thank you so much, Dr. Shah, for being with us.
Thank you.
Thank you.
Thank you. And it was nice. Dr. Preeti, all the best. And all of you are doing wonderful job.
Thank you, Dr. Mili.
Thank you.
So now we move on to our panel discussion. It will be moderated by Dr. Anish Musa. The panel discussion will dig further into the topic of autoimmune conditions and discuss solutions how to tackle them. Dr. Musa, over to you.
Thank you very much, and namaskaram to everyone. I am Dr. Anish Musa. I am a functional medicine doctor and founder member of IAFM. Now we see a rise of autoimmune disease in India, and autoimmunity can target any organ like brain. We can see multiple sclerosis and ulcerative colitis, to Crohn's disease, to thyroid disease like Graves and Hashimoto hypothyroidism. So in even conventional medicine says that if you are diagnosed with one autoimmune condition, then you have 3 times higher risk of developing another autoimmune disease. And we are seeing many patients who have multiple autoimmune conditions. So it is very important to work to find out the root cause, to prevent, and how we can reverse. So today we have speakers to discuss about the autoimmunity. So my first speaker is Dr. Visalam Ramanandan. She is from Chennai. She is MBBS and MD, and she has more than 10 years of experience in a physiology and autoimmune condition. She is certified also in functional medicine by IAFM. My next speaker is Dr. Gaurang Ramesh. He is also MBBS and MD, and he is specialized in surgical gastroenterology, and he is also certified in integrative and functional medicine by IAFM. My next speaker is Mahesh Jayaraman. He is also running a Sepalika.com online clinic. It is a women's healthcare clinic. He has treated hundreds of women with an hormone dysfunction, and his specialties and PCOS, infertility, by doing a natural treatment with an integrative approach with diet, supplements, acupuncture, and the rest of things. My last speaker is Suyash Bhandari. He is having more than 10 years of experience in nutrition, and he is also running an supplement vertical at iThrive. So welcome you all speakers. So I want to start, see, when we discuss about the autoimmunity, we should know more about gluten, because gluten is sometimes it's a primary food trigger that leads to autoimmunity. So I want to start my first discussion with Dr. Gaurang. Gaurang, can you present a screen and can you show us some science behind the gluten and gluten disorder in India?
Thank you, Dr. Anish, for a wonderful introduction. I'm truly honored to be sharing the stage with my mentors and teachers, along with such experienced panel of doctors. So quickly, within 10 minutes, I'll just give a brief introduction of how gluten can lead to autoimmune diseases. So this trend of gluten-free, as we've been hearing since a couple of years now, and it has gone to such an extent that in US, and other Western countries, there are gluten-free startups, gluten-free markets, gluten-free restaurants. And because it's become so widespread and it's not being done well, people who are trying to be gluten-free are also ending up with nutritional deficiencies. And that's why nowadays it's also getting a negative, bad name. So there are different pathological mechanisms which are responsible for this wheat-related issues. So we all know about celiac disease and how we have a lot of evidence of gluten being responsible for the pathogenesis of celiac disease. But now we also need to look at wheat allergies, which is IgE mediated, and we have to look at non-celiac gluten sensitivities and non-celiac wheat sensitivities. So we can start by understanding the mechanism of celiac disease, where the gluten, of course, the wheat has inner endosperm and the outer germ layer. The inner endosperm, 80% of it is formed by gluten, and gluten is broken into gliadin and glutenins. So this gliadin enters the lamina propria, and once it's recognized by the antigen presenting cells, it stimulates the T cells, CD4 T cells, and that again stimulates the cytokine storm, which completely destroys sometimes the intestinal villi. And this, of course, is mediated by the HLA gene mutation. And of course, only 2 to 3% of people with this HLA phenotype will have the evidence of celiac disease. But what is interesting about celiac is it's not confined to intestinal enteropathy. We see extra-intestinal manifestations also. We can see gluten-induced neuropathy, where people have evidence of serum tissue transglutaminase antibodies positive, and they also respond to strict gluten-free diet. But many of the patients will not have any intestinal mucosal lesions. And we also see dermatitis herpetiformis, which is also gluten-induced, and 30% of the patients will not have any small intestinal mucosal disturbance. So this shows that it's not just a local inflammation, there is adaptive and innate immune-mediated response in the body. So today we know that everything is just not in genes. We always have the field of epigenetics has shown us that there is an environmental trigger for any manifestation of autoimmune diseases. And the altered intestinal permeability, which allows the gliadin to enter into the cells, is known as the potential trigger. And everything which alters the intestinal permeability can be a trigger. It can be stress, it can be infections, especially childhood infections with rotavirus and other bacterial GI infections. There can be many chronic diseases which can be insufficiencies, which can lead to the trigger of this pathogenesis. Sorry. Non-celiac gluten sensitivity and non-celiac wheat sensitivity. So non-celiac gluten sensitivity is people who develop intestinal and extra-intestinal symptoms, but they have no evidence of celiac disease. And wheat sensitivity are patients who are not sensitive to gluten, but other component of wheats. Like there are also FODMAP carbohydrates in the wheat, there are lectins, and there are ATIs, which I'll be with you. So this hypothesis, initially in the textbooks, we always study that, only celiac is the only problem with gluten. But this hypothesis that there is non-celiac gluten sensitivity has the highest level of evidence. This double-blind randomized placebo-controlled trial shows that patients were included with clinical evidence of not having any celiac disease. And in these patients, people were significantly worse with gluten in terms of GI symptoms pain, bloating, and satisfaction with stool consistency and tiredness. So when patient comes to us with IBS kind of symptoms and they tell us that, okay, wheat may be responsible, I feel bad with, I'm not able to tolerate wheat, then whom do we blame? Celiac disease, we know what to test and how to test and what are the indications, but we cannot stop with that. We need to look outside of celiac disease. And we can also think of wheat allergies. So wheat allergy is IgE mediated. It's like any other food sensitivity. You will have histamine overreactivity symptoms also. And another argument is there can be FODMAP intolerance, and it doesn't have to be gluten. So, of course, there is carbohydrate in wheat, which belongs to the FODMAP criteria, but then this is a very minute quantity. This may cause a little bit of GI symptoms like bloating and abdominal discomfort, but it's not enough to stimulate systemic inflammation or autoimmune disease. So for this idea also, there is a double-blinded randomized study where patients were given carbohydrate-free gluten and placebo group, and there was significant increase of GI symptoms in patients with carbohydrate-free gluten compared to the placebo. So what is the problem with non-gluten? It's a protein called amylase trypsin inhibitor, which is non-gluten. This is a pest-resistant protein, especially in wheat, barley, and rye. And this is very resistant to intestinal proteolysis. And especially in the modern variety of wheat, we see 17 different species of amylase trypsin inhibitors. So this amylase trypsin inhibitors also have a similar mechanism of action like gliadin. So this also gets into the cell. It is activates the CD4 T cells, and through IL-15, IL-8 activation, it leads to adaptive immune response, and it also can stimulate mast cell activation. So you might also have patients presenting with histamine sensitivity symptoms. So this modernized hybrid wheat it's not just marginal increase of ATIs in this hybridized wheat, but there is several fold increase of this in the modern wheat compared to the traditional wheat. And another component of wheat we need to look at are the lectins. So these are also small glycoproteins which are resistant to proteolysis, and they adhere to the cell surfaces, epithelial layer of the intestines. So there is evidence that these lectins can cause intestinal inflammation and lead to.
Yeah, Gaurang, thank you very much for explaining in great detail about, because we are running out of time.
Yeah,
so
sure.
I would like to interrupt here. So basically 40% of population we see nowadays, they have a genetics like HLA DQ2 and DQ8. And only 2 to 3% patient having a celiac disease, that is an extreme form of gluten allergy or gluten sensitivity. But Dr. Visalam, do you find any non-celiac gluten sensitivity in your patients, or do you experience that patient having an wheat allergy or non-gluten sensitivity?
Thank you, Dr. Anish. It would be wrong of me if I said it's not 100% other than my pediatric patients. What is non-celiac gluten sensitivity? It's a clinical diagnosis of patients who come with intestinal or extra-intestinal symptoms. Patients who come to us always and almost have bloating, burping, constipation, brain fog, fatigue. They're all the symptoms of non-celiac gluten sensitivity. So I would actually say 100%, and during the detoxification process, the first elimination is always gluten. And that's where we start. We can try reintroducing it, but we always start there. So the answer, Anish, is 100%.
Yeah, so nowadays, when we look at the alternative medicine, functional medicine in internet, always everybody say about the gluten. Gluten is bad for everybody. So Suyash, do you feel that gluten has to be avoided in everybody, or do you have a specific protocol that we want to avoid the gluten in this kind of patients, and we can allow a small quantity or certain foods in this kind of patients? So do you have any protocol for gluten allergy or gluten sensitivity?
Yeah, so first I would like to definitely, like thank you, Dr. Anish, and I would like to explain why, like gluten needs to be avoided in all people. So ideally, yes, definitely like gluten should be avoided by all people, and especially people suffering from autoimmune or any, kind of chronic diseases. So when clients come to us, one of our first recommendation is that they avoid gluten because there are a number of different problems with gluten. But like one of the problem with gluten is there an addictive component of the gluten itself. And as like Dr. Gaurang and like Dr. Visalam as well, explained pretty much well like why non-celiac gluten sensitivity is we see in like almost all the people. So once we eliminate that, and that's where they like the symptom starts to fade away, and then that's where they experience it. So until unless we will not eliminate, we'll not be able to know that whether they actually like the client itself doesn't understand that whether they have the gluten sensitivity from that as well or not. So ideally gluten also is inflammatory to the body and can inflame the microvilli in the gut and can poke holes, as like Dr. Gaurang very well explained as well. So what happens is when their addictive component reacts with the gluten, that's where it becomes very, very hard for the clients to like become challenging. So one of the reason is whenever there is any kind of autoimmune conditions or chronic diseases, definitely we avoid specifically in those clients gluten for sure. But even if they are not like they're not experiencing any digestive issues, even when we eliminate from those lines as well, still we have a lot of benefits specifically, and we get a lot of results in the same as well. So yeah, definitely like we need to avoid for sure like gluten.
Yeah, so thank you very much for then. Even I look at the research, even Dr. Fasano, if somebody knows, then he's a researcher regarding the gluten and celiac disease. So he mentioned in his book that, everybody when eat a gluten, they create some kind of leaky barrier or leaky gut. So those patients who definitely having some kind of chronic condition, we usually suspect maybe a gluten ate trigger. So we want to avoid that. So, Dr. Gaurang, we have a lot of confusion in conventional medicine regarding the food allergy. Like, and we learn allergy like IgE reaction. So when somebody eats some food, within 2 or 3 hours they start developing some kind of symptoms. But as we know in functional medicine and foods, non-celiac gluten allergy, that is food sensitivity. So in that, we have a delayed kind of reaction. So can you throw some light about what is the difference between food allergy, food sensitivity, and how you diagnose food sensitivity?
Yeah, sure. So like I was mentioning, food sensitivity is IgE mediated. Like you were said, it is more immediate in terms of symptoms, and the patient, like for example, you have gluten sensitivity, so you immediately get some symptoms when the patient consumes the food. But food intolerance can be adaptive immune mediated. It can be IgA mediated. So it will there may be systemic symptoms before the patient gets any GI symptoms. The patient perfectly has normal stools, no bloating, but they may have skin lesions, psoriasis. So that is why it's difficult to diagnose food intolerance. So for food sensitivity, we have skin tests, and we have IgA and IgE tests, which can be done by serum. But the best diagnostic test we do in terms of sensitivity is when we do a diagnostic diet, which is the elimination diet, which all of us are following. So because we get, when patient compliance is good, we see the results immediately, and it's easier for patient to understand how well they're improving also when we do a diagnostic elimination diet.
Yes, I think best tool is a clinical tool, that is elimination diet and reintroduction. We can find out the sensitivity. But Dr. Visalam, do you suggest any kind of, when there's a confusion regarding the gluten sensitivities, so do you find any kind of IgG testing for gluten, or do you recommend any test for that?
I don't completely rely on labs for it, because most of the allergy tests come back as they're not gluten sensitive. But when they stop gluten, they get better, or vice versa. So I think it's a very, very clinical diagnosis and clinical steps to take forward.
Okay. So thank you very much for that answer. So best diagnostic tool is, we consider, is a elimination diet, where you can eliminate the gluten for at least 1 month, and then you can reintroduce to see the effect of that. So we now see a lot of connection between the gut and the autoimmune disease, and we usually consider gut is a primary organ that is involved in an autoimmune disease. So Mahesh, do you feel any connection between the gut or intestine with your hormone or PCOS kind of patient?
Thanks, Dr. Anish. And yes, absolutely. I think every patient who comes in with polycystic ovarian syndrome or polycystic ovary disease will have some sort of an involvement of the gut. That has been our clinical experience. Even in the research studies, it seems to show that patients who have PCOS actually have a disturbed gut microbiome compared to people who don't. And we are all well aware of the insulin resistance connection that comes in with PCOS. So these people have excess insulin resistance, and that leads to higher level of androgens or male hormones, which then disturbs their entire period cycle. And it's sort of a hormone cascade from down there. Also, an important thing to remember is, hormones are meant in our body. The saying is, use it and lose it. So while a woman has high estrogen in the first half of her reproductive cycle, that's day 1 to day 14 of her period cycle, then after that, progesterone is meant to take over after ovulation, and the gut plays a crucial role in eliminating the excess estrogen. Now that it has been used, along with the kidneys and the liver, it plays a crucial role. So whether those estrogens will be properly eliminated and removed, or will they keep circulating and cause inflammation, that is something that the woman's gut health is going to determine. So many times, if you have PMS-like symptoms, bloating, mood swings, etc., if you look to the gut, you may often find that the gut hormone axis is what is impacted, and fixing that can often help these people.
Yeah. Thank you, Mahesh. Now, we can see like a lot of connection, like we have a gut-brain connection, we have a gut hormone connection, and we have a gut-skin connection. So gut is a primary organ that is involved in so many chronic disease, but actually what is that connection? What is that in the gut that leads to so many imbalance in other factors? So to discuss that, we consider gut microbiome or gut bacteria that may play a bigger role in our overall health and physiology. And when I was studied conventional medicine, I always ignored the gut and gut microbiome and this. But when I started learning functional medicine, first thing I learned is there is a missing organ in a conventional medicine, and that is gut bacteria or gut microbiome. We have a diverse microorganism in our intestine, like bacteria, fungi, even virus. They're all collectively known as a gut microbiome. And a microbiome that weight almost 1.2 kg. And recently I come to know this. So Dr. Visalam, do you feel that is a imbalance in a gut microbiome or a bacteria or a virus or a fungi that leads to autoimmunity, or how you describe the dysbiosis and its diagnosis?
How do you know that the patient has gut dysbiosis? I think, honestly, when they walk in, I understand that they have gut dysbiosis. If they didn't have gut dysbiosis, they wouldn't walk inside a functional medicine clinic, number one. Number two is gut microbiome is 3 times more than us. So if they are not healthy, then it will start telling us in the form of symptoms. It can even be the minutest hair fall. And you know that GERD is the commonest cause of hair fall. Nobody knows. And GERD can be caused due to gut dysbiosis. So and today, Dr. Anish, we have a lot of stool testing to do, which will show us on paper the good bacteria are high in number, the bad bacteria are low in number, or vice versa when you have a gut dysbiosis. And all hormonal imbalance patients, obesity, hypertension, diabetes, autoimmune for sure, we always start with correcting their gut dysbiosis after eliminating candidal infections and all that, and then increase their good bacteria.
Yeah, Dr. Visalam, do you recommend any specific test for diagnosis of dysbiosis or infection in the intestine? The stool testing you are talking about?
Epstein-Barr virus is the biggest cause of gut dysbiosis. In fact, there's a school that says viral infections trigger your autoimmunity, starting from Epstein-Barr virus to hepatitis and everything. Yes, virus do trigger gut dysbiosis. And H. pylori infection is the commonest cause. All the viruses are a commonest cause. Candidial infection, worms, parasitic worms, they all indicate gut dysbiosis and can also cause gut dysbiosis.
Okay, thank you very much, Visalam. So those who don't know about dysbiosis, let me define the dysbiosis. It's basically an imbalance in your good versus bad bacteria, or even the good bacteria if they lost their location. For example, we have a minimal bacteria in our stomach and small intestine. Our majority of bacteria, they lies in the large intestine and a lower part of large intestine. So if even you have a normal bacteria that grow in a small intestine, that is also called a dysbiosis, or in a simple term, we can say small intestinal bacterial overgrowth. So if you are imbalanced in the gut microbiome, then you also start developing a systemic effect of this imbalance, and that is may leads to the autoimmune condition. So Dr. Gaurang, as to continue with an testing side or investigation of gut dysbiosis, so again, would you like to input anything that you do in your patients for diagnosis of gut dysbiosis? Any specific recommendation do you do for stool testing?
Yeah, so as you all know, sending the sample to US is very expensive. So I have not pushed my patients to spend so much for the complete stool analysis, but I always try to assess clinically from we call it north to south approach. From the north, you assess the vagus nerve, you assess the swallowing, you assess acid secretion if there's any bloating or burping, and then you assess small intestinal gas by bloating, and then you come down. So that is one thing. If you want to go the more detailed, our Indian test, when you combine the gut microbiome along with organic acid tests, you will get a little bit of information, because candida will always get missed in stool analysis, because it's usually a small intestinal overgrowth, and when it comes down into the large intestines, the bacteria overpowers candida, and many times it will be negative. So for that, when you also get some evidence of candida overgrowth on urine organic acid, we can make a better diagnosis on that.
Yeah, doctor, thank you very much. So as you are saying that even we can diagnose the candidal dysbiosis or candida overgrowth in the intestine from the urine test. Yes, that is an organic acid testing. From that organic testing, you can also diagnose some kind of bacterial dysbiosis, even fungal overgrowth in your intestine. So to continue with that discussion, I would like to ask a question to Suyash. So as we know, the gut microbiome or imbalance or maybe infection, we also recommend some kind of prebiotic and probiotic. So what are your thoughts about describing prebiotic and probiotic, and how you think about gut dysbiosis? What is your approach in food and prebiotics?
So thank you, Dr. Anish, for asking the question. So first of all, like what we do here at iThrive is we incorporate, 3R approach, which everyone like of us will be aware for sure, for increased microbiome diversity and gut health. So which is like, let's discuss, each of them. So for the first R is your removing of all your processed and inflammatory food, sugar, gluten, which feeds pathogen and bad bacteria. And then moving to repairing the gut linings, repairing the integrity of the gut itself. So the focus of gut repair is on improving the tight junctions of the gut lining, so getting rid of all the undesirable bacteria, the yeast, overgrowth, parasites, mold infections, which are, of course, Dr. Gaurang, Dr. Visalam, everyone has talked here about. And like we also use a lot of antimicrobials like biocidin, colloidal silver to get rid of all those bad pathogens for the same as well. And once we're done with that, so then what we do is we reintroduce and re-inoculate the gut with the foods, like clean, organic, healthy food choices and plenty of pure filter water, like which basically is simply foundation of the gut health. So including foods like fermented foods, of course, which we have been talking about here in the conference as well, like kimchi, kombucha, kefir, and fermented vegetables also helps to increase the good bacteria as well. And then probiotic, before probiotic, of course, the prebiotic fiber foods, which actually feeds the good bacteria as well, and like garlic, onions, chicory, apple, bananas. And then when we come to probiotic, what we suggest here is like taking a broad spectrum probiotic which has multiple stains in that, which surrounded more than, and it should be more than around 25 billion CFUs, which is we have found very, very effective in a lot of our clients. Of course, if there is a SIBO, then we definitely don't go for the probiotic because it can make the things worse. So yeah, like definitely like probiotic and prebiotic has been playing a major role specifically in the gut health itself and to increase the microbiome diversity as well with food.
Yeah, you recall me on 5-hour functional medicine program to heal the gut.
Exactly.
So that is 1 hour is we want to remove. So we have a lot of tools. Now we're discussing in conference, like we have ozone, we have antibacterial kind of horrible things. So yes, and we have to remove the offending food, that what you are discussing. Yeah, Dr. Visalam, can you explain in some detail about 5-hour program of functional medicine in some detail so we can continue discussion over there?
Hello?
Yeah, we can hear you.
Sorry, yes. So I'm sorry, can you repeat the question, Dr. Anish?
So basically, Suyash is telling about the basic programs, everybody should follow for gut healing. So that is 5-hour program. So remove, replace, and could you explain the program?
Yeah. So you remove your toxins, you remove your allergens, you remove all your extra growth by removing all your triggers. Replace is, how do you replace? Because once you remove all the bad things, today people only eat the bad things according to functional medicine. How do you replace all of them with alternate foods, alternate nutrients? And you re-inoculate. Re-inoculate with good bacteria, re-inoculate bacteria from the beginning, because there's also a school of study that says if you start re-inoculating good bacteria then they already have small intestinal bacterial overgrowth or candidial overgrowth, then the treatment or the results might not be as expected. So you have to remove them first, give the body a clean environment before they can start absorbing things. So remove, replace, re-inoculate. I usually combine all the R's and start with them, on a monthly basis. I don't go phase-wise, but on a monthly basis, that's what I do. 2 weeks of each of it, and the results are brilliant.
Yeah. Thank you very much, Dr. Gaurang. Do you feel that certain patients you would like to avoid the probiotic, or what kind of probiotics would you prescribe, or what prebiotics you prescribe?
Yeah. So the thing about pre and probiotics is when we talk about inoculation, it doesn't easily happen with just supplementing it. So we need to create a good environment for the bacteria to inoculate. So that is by optimizing the enzymes and the digestion and everything. And once we do that, our probiotic starts helping. So we can keep, of course, supplementing a probiotic may give you benefit, but if the environment is not done, like how Suyash mentioned, we have to eliminate the what is causing disturbance, then the bacterial long-term effect will not be there. It's only when you are taking the pill and once you stop it, it goes. The second thing is we also always have to remember this principle of going slow and going low, especially with prebiotics, because prebiotics can be related to FODMAP and they can cause bloating. And when you introduce a lot of prebiotics initially, then patients may develop of more increased symptoms of bloating. So we have to start at a very low dose and gradually increase. And when it comes to probiotics, sometimes the therapeutic dose can be up to 300 billion CFUs also. But there is still now, although we can do the microbiome test and then decide, we have not reached a stage where we can specify, okay, this patient needs this strain or this species of bacteria, because it's very variable thing. And even with 24 hours with your change in diet and lifestyle, there can be shift in microbiome. So right now, the science supports a broad spectrum probiotic. Of course, there is evidence that specific, like for example, H. pylori adhesion can be prevented by some lactobacillus rhamnosus, or there is some indications for Reuteri. Like that, specific things are there, but in general, we are still in a stage where broad spectrum can be continued.
Yeah, okay. So even I'm also reading to research that, probiotic cannot be colonized in the intestine. It's a prebiotic, or the food or the environment that we are creating with the food and rest of things that really determine change and a shift of gut microbiome in the gut and intestine. So Mahesh, as you are seeing a lot of patients with an female hormones, so do you find any specific relationship between your gut microbiome changes and hormone disturbances, or do you prefer any specific strain for hormone balance?
Yeah, so like I said earlier, there is indeed a connection between hormone health and gut health. In fact, so much so that nowadays the term estrobolome is used. So not just a microbiome, but the gut bacteria which decide how estrogen is going to behave in your body. So whether estrogen is going to get recirculated, especially the more harmful metabolites of estrogen. So we know that once estrogen is used in the body, it goes down a pathway of conjugation or breakdown. So it can go into a 2-hydroxy, a 4-hydroxy, or a 16-hydroxy. And there the 16-hydroxy is the more inflammatory metabolite of estrogen. And many times when there is gut dysbiosis, you will find that the 16-OH pathway is preferred in the person's body. And therefore that can lead to a excess estrogen dominance kind of situation where there is too much estrogen, and especially a proliferative kind of estrogen, which can lead to things like fibroids growing, or even something serious like endometriosis. So as far as we are concerned, we follow the same functional medicine principles at Sepalika. So crucial to sort of eliminate the offending foods. PCOD, as you know, is often a young woman's disease, and so much processed foods all around us. You try going into any major coffee shop, I don't want to name any brand, but try and find something without sugar in it. Other than the black coffee, everything's going to have processed maida, and it's going to have processed sugars in it. That's going to feed the bad bacteria, and in turn, it's going to lead to the hormonal imbalances that we see in the girls. So first eliminate, the place where the fire is actually being lit. Then you can introduce. So one of the things that we do is we try to, hold back on any professional probiotics. So yes, there are great brands like, the old Warhorse VSL3 that is available refrigerated in this country. But still, we try and sort of, stay away from that, and initially try the simple things to do, like a recipe called paranganji. It's called various names in various parts of the country. In the south, we call it paranganji. It's basically cooked rice, which you then let it sit overnight with water on top of it. And you get the natural formation of a broad spectrum of good bacteria in it. And in the morning, you just do the usual Indian style tadka, because it has a coolant property. So you don't end up getting too much phlegm or anything. You just put a tadka and you have that. And you find that with a period of time of usage, let's say of about a month or so, it's extremely nutritious, gives you a lot of B vitamins, and it gives you a whole broad spectrum probiotic, which is now from food. In Indian culture also, all the pickles that we use and all the fermented foods that we use, these are things that are natural probiotics that can make a huge difference. So we often find that, so by removing the offending foods, reducing the inflammation, and giving people the right balance of probiotics, even dietary, you can make a huge difference to the hormone imbalances, to period health, to infertility. Lots of things on the higher floors get fixed once you fix the microbiome in the gut.
Yeah, that's very nice. You know, every culture in every part of India and around the world, we have specific probiotic food, and we can say achar, pickles, and everything. So every culture has their own prebiotic food, and we in this lifestyle we forgot about that. Thank you for reminding that. And you know, in conventional medicine, always they say that autoimmune disease are not curable. Even we cannot prevent. So always, you know, conventional doctor says it is because of your genetics that you develop a autoimmune condition. So I would like to continue discussion about the autoimmunity. And Dr. Visalam, does really we can work on a prevention of autoimmune disease, or really we can reverse the autoimmune condition? And what is your protocol about autoimmune disease?
Yes and yes to both of it, Dr. Anish. Prevent autoimmune condition, yes. Reverse autoimmune condition, yes. I am a living example, and I'm sure half of the panel here is a living example. IBS, IBD, diabetes 1, multiple sclerosis, Alzheimer's, psoriasis, Hashimoto's, everything is very much manageable, very much reversible. My protocol, basically, we start with elimination, we start with detoxification. And what my mentor, Dr. Terry Walls from Functional Medicine, Institution of Functional Medicine says is 3 cups of colored vegetables, 3 cups of greens, 3 cups of sulfur-containing vegetables, fermented food, lot of water, sun, meditation, yoga, specific nutrients that you can be deficient with, sleep and movement. Movement not in forms of gym or exercise, but general human kinesthetic movements. Those are movements that we require. And let's not give importance to alternative therapies like acupressure, acupuncture, aquatherapy, ozone therapy by itself, sound healing. All of those alternate therapies also help. Sauna, steam, they also help autoimmune patients, especially when they come with pain. Medical cannabis is another emerging science that also helps. Like Dr. Anjali said, low dose naltrexone helps a lot of autoimmune patients. I've had alopecia areata patients who actually came with clean scalp, and now they have good enough hair with low dose naltrexone. So that also helps autoimmune conditions, depending upon the progress. It's not we start with medical cannabis or low dose naltrexone immediately. We start them with elimination, diet, other protocols, everything. And still, if their mitochondria, if it's very difficult to activate the mitochondria with all the supplements, how many supplements can we put them on? Then we send them to ozone therapy, acupuncture, acupressure, medical cannabis, low dose naltrexone, and all of that to integrate the treatment. Functional medicine is also integrative medicine. Siddha, Ayurveda, your adaptogens also work very well for autoimmune conditions. To conclude, Dr. Anish, yes, preventable and reversible. Yes.
Yeah, thank you very much. But as you mentioned about cannabis, so can you throw some light about what is what kind of patients do you like to recommend medical cannabis?
I actually give it to a lot of insomniac patients, pain patients, neurodegenerative conditions, Alzheimer's, Parkinson's, multiple sclerosis, also mental disorder patients, bipolar patients, depression patients. Autistic children benefit greatly with medical cannabis. CBD isolate, autistic children greatly benefit. When I get parents, they come back and say, earlier they do not voluntarily start a communicative method. Then with medical cannabis, they start communicating. And especially autistic children, they're very restless. They can be self-harming as well. They calm down. They surely calm down. Autistic children is something that I've seen great benefits.
So you mean to say the all kind of neurodegenerative disorder or brain disorders, they help in cannabis?
You can start with it, and it can definitely. Alzheimer's patients come back and say their deterioration of memory loss has stopped. In fact, there's also been improvement depending upon the dosage. Medical cannabis can be very tricky, so you'll have to dose it accordingly, like all our other supplements. You'll have to dose it accordingly. But yes, it's an emerging science and it's a proven science. Medical cannabis is one of the 5 king herbs of Ayurveda, right?
Yes, thank you very much for that. And a lot of discussion is about nutritional deficiency, and vitamin D is one of the prominent nutritional deficiency we can see in our day-to-day clinical practice. I see all the patients, those working in my clinic, they have severe kind of vitamin D deficiency. So we know the vitamin D deficiency is a trigger or maybe mediator of an autoimmune condition, but the Suyash, do you find any specific nutritional deficiency that leads to autoimmune condition or a gut imbalance?
Yes, Dr. Anish, vitamin D3 deficiency is extremely common in all parts of the world, regardless of sun exposure, like due to being indoors, maintaining concentration, like clothing, sunscreen, malabsorption, infections. But there are some other, nutrient deficiencies also, which we see with a lot of our clients, with the blood work which we do, with the analysis which we do. So the first and foremost is the B vitamins, like all the B vitamins definitely is what we see there in the CBC panel. With that, magnesium for sure, like we see is deficient because of its absorption, because of like not getting enough from the food itself, and because not having a really good gut health as well. And then zinc, omega-3 fatty acids, your like vitamin A specifically in vegan and vegetarians, vitamin E in like people who have very, very high oxidative stress is what we also see, deficient them. And then again, protein, very, very important when we are dealing with vegetarian or vegan clients, so which they lack with the essential amino acids as well. So now, like what we generally do is like basically like we start to like work on the gut, because the healing the gut is the key, for most of the like breakdown and absorption happens there. So if we are not healing that, then we can supplement with them for sure with all of these nutrients. But if you're not healing the gut itself, then definitely once they are back their routine regimen lifestyle, definitely they will become deficient again in it. So then again, supplementing will help, and then again removing their antagonists like medications. A lot of PPIs, proton pump inhibitors, antacids, don't let nutrient absorb specifically like magnesium, and a lot of B vitamins gets deficient. So yeah, like these are some common deficiencies which we definitely see in the all of our clients' blood work, and then we supplement them with all of them, and like with of course correcting their gut health and correcting their food patterns as well to overcome it.
Yes, thank you very much for that. And we are seeing a lot of patients with PPI, and we know in functional medicine that low stomach acid particularly also inhibit iron absorption. So many of my patients, those who have iron deficiency, I usually prefer stomach acid, and I will correct the stomach acid first. Regarding the quality of supplements, in India we have a lot of variety of supplements available. Like medical store you go and you can find out some nutrition, B complex, and these things. And also we have other brand that is too costly or higher brand. So we have a different category. Like I can say it's a medical store category, or we can say a nutraceutical category. So yes, do you prefer specific grades of nutrition, or it's just any nutrition that available near market that work in your patient?
So like Dr. Anish, we really need to understand that the quality, its bioavailability, and of course like where it's being derived from, what is its source, is very, very important, because our body doesn't body will not able to absorb the synthetic vitamins or the synthetic nutrient itself. So if you go over the counter like and take vitamins and pills, like without even knowing that what bioavailability they will provide, and then what is their quality, where it's coming from, definitely it's like a more added load for our body to get it out of a system, and then body will not be able to absorb that. So the first and foremost we see is the bioavailability. So for example, if I take an example of, let's say, if I take an example of vitamin B6. Now vitamin B6 is in two form, right? Pyridoxal form and the pyridoxine form. Pyridoxal is the animal form, and then pyridoxine is the plant form. So what we want is that specifically that pyridoxal form needs to be there, so the body can absorb that easily. Similarly, like a lot of these nutrients have different bioavailability forms, and what we want is the bioavailable form, so that the body can easily absorb, and then it can like the deficiencies can simply be overcome with that as well. And then the second thing which I see is getting rid of the fillers and the additives and preservatives. Any unnecessary additives, fillers, preservatives, colors, we need to make sure that it is as minimal as possible. So when you go on over the counter stores, they definitely involve a lot of colors like titanium dioxide, a lot of preservatives, unnecessary fillers as well certain times, and then they are in tablet form. So there is this very, very main important difference when tablet form and capsule form is. Tablet form is so compressed, it's very, very hard for a body to, absorb. Similarly, on the other hand, on when it's in capsule, that's where it's easier for a body to, absorb. So I was reviewing the research, other day, as well, that there is around half an hour of time difference specifically in tablet absorption and capsule absorption. So capsule makes it absorb around 10-15 minutes. On the other hand, tablet takes around 30 minutes to 45 minutes to get properly absorbed, and even in that part, if some of the things doesn't get absorbed, then it will just go on a waste side. So definitely, quality, bioavailability, it's like no additives and fillers, with minimal additives and fillers with preservatives. It's a very, very important point when we talk about supplements specifically.
Yeah, thank you very much, Suyash. So Mahesh, we are seeing a lot of you had mentioned about the estrogen dominance and female hormones. So do you have any protocol for this estrogen dominance, or do you prefer any supplements or nutrition for this kind of patient? And even we can see the estrogen dominance may be linked to the autoimmune condition. So can you throw some light on that?
Absolutely. I think the first thing to understand about this term that is used a lot these days, estrogen dominance, is that it is relative estrogen dominance, right? So it is very important for us to understand that sometimes these popular terms become a fad in the sort of health circles a little. And it is natural for women to have a lot of estrogen. That is their natural state. That is how the reproductive system has been designed by nature. And so when we speak about estrogen dominance, it's always in relation to progesterone. So, we always explain to our patients the simple period cycle, day 1 to day 28, day 1 to 14 dominated by estrogen, day 14 ovulation, and progesterone begins to ensure that estrogen doesn't continue to proliferate or build the inner wall of the uterus, and so on. And then towards the end of the period, if there is no viable pregnancy, then the excess estrogen needs to be removed, as does the excess progesterone. So everything in the body is getting recycled. So when it comes to estrogen dominance, as we call it, we need to be sure whether the person truly has too much estrogen per se being generated in the body, or is it that because of a gut imbalance or because of certain genetic predisposition to inflammatory pathways, the estrogen that should be removed is simply getting recirculated. And depending on that, you need to therefore have different treatments for different people. So, for example, one of the most popular supplements that is used is DIM, or diindolyl methane. And it's basically, found in large, it's a chemical that is found in large quantities in cruciferous vegetables like cabbage and cauliflower and so on. But any practitioner here, and I know that lots of people do use DIM, who has used DIM will often find that in 50% of cases, DIM will worsen the symptoms. You'll get more headache, you'll get more bloating. So the question is, why is that happening? This can often happen because there is a relative estrogen dominance. DIM has the ability to reduce estrogen pretty substantially. And if the person had low estrogen and had even lower progesterone, you'd still diagnose them with estrogen dominance. But if you gave them a DIM supplement, you will find that their symptoms actually worsen. So when it comes to estrogen dominance, you have to be very careful. The absolute numbers also matter. When you test on day 3, when you test an estradiol, it gives you an indication. Then you tie it back to the clinical symptoms. Does the patient feel bloating just before the periods? Is there water retention? Is there pitting edema? What are the symptoms that you're finding for estrogen dominance? And then again, like Dr. Gaurang mentioned, always start low and go slow. Don't be in a hurry to over-medicate, especially with a supplement like DIM. And for example, for all the functional medicine practitioners here, I'd like to share our experience. We've treated close to 800 patients with PCOD, infertility, things like that. Our experience shows that if the person is actually estrogen, low on estrogen, despite having estrogen dominance, then using sulforaphane, which is more from broccoli sprouts, can actually help to not reduce the overall amount of estrogen, and therefore give the person the desired benefits of removing the poor quality or inflammatory estrogen metabolites, pushed it out of that pathway and into the non-inflammatory pathway. So it's important to carefully diagnose estrogen dominance, whether it is absolute or it is only relative, and you will find that clinically you will get far better results. Of course, it's a no-brainer to say, make sure that your patient has sufficient fiber in the diet, and they've got they're drinking enough water. All elimination of estrogen and every other hormone needs to happen either through the urine or through the feces. So you're either converting it into a polar molecule, and therefore enough water, and ensuring that the cofactors are there to remove the excess estrogen, and similarly enough fiber to ensure that it's removed from the stool. So those are the basics that I would say. Don't be in a hurry to medicate for estrogen dominance. Start with the basics.
Yeah, thank you, Mahesh. And now we take a question from the audience. So, Visalam, we have a lot of questions regarding cannabis, because there was a new topic to the functional medicine world, and people are asking about where to buy and whom to consult about. So, can you just answer this question about cannabis?
Medical cannabis has been legalized almost all over the world, and it is legalized in India as well. And there are multiple stores. There's cbdstore.in. There's Med Cannabis. I can put all the links in the chat for you to buy, but you'll have to buy it with a prescription. So which means you'll have to go for the consultation. Each platform has their own set of doctors. And of course, you can always come to me for medical cannabis prescription. But I per se do not give only medical cannabis prescription. There's a lot of options. There's a lot of places where they can misuse it. But as a part of the package, as a part of diet, exercise, sleep, everything, to supplement it for it to be effective, yes, I do prescribe medical cannabis, and I will make sure I put all the links of where you can buy medical cannabis in India. I'll put it in the chat.
So basically, it's come under prescription drugs, so you cannot buy over the counter. You require prescription of the doctor, right?
Yeah.
Okay. Thank you very much for this. So those who are looking for therapy, just look at the chat and you can get the answer. So one question is for me, that is there any role of gluten in uveitis? Yes, uveitis is an inflammatory condition, and sometimes it's an autoimmune condition. So we have to find out the autoimmune trigger. And in many of my patients, those who come with an uveitis, we had find out the gluten. So start gluten-free diet for 1 month, and you can see the effect within a 1 month.
In fact, Dr. Anish, I had uveitis before I was diagnosed with MS. The uveitis is where it all started for me. So yes, gluten.
Yes. Yes. Thank you. Thank you very much for giving us. So many patients, those who have, see what I told you earlier, one autoimmune condition also trigger to other autoimmune condition. So many patients we see with autoimmune condition, they usually have multiple system involvement. There is no only the one system that is involved in an autoimmune condition. And Mahesh, you had talked a lot about the food and this thing. So there's a few questions about, regarding a specific food that we should incorporate in our hormone imbalance patient. Like if you were talk about the estrogen dominance and estrogen kind of thing. So can you just figure out top 3 or 5 foods that we should incorporate in our estrogen dominant patient?
Yeah, so, we start with the basic plate. It is really easy to remember. I think all of us in functional medicine start there. So, if you think of a round plate in India, think of 1/4 vegetables as being uncooked, your salads, 1/4 vegetables as being your cooked vegetables at least, 1/4 as whatever protein source, whether it's dals, pulses, paneer, if you're non-vegetarian, then chicken, whatever meat you're having. And only 1/4 of the plate should be the grain carbs. And all of this food should ideally be cooked in good quality fats, which is either good quality desi ghee or the cold pressed oils, depending upon, what really suits you. India, we use a variety of oils. You get wonderful cold pressed oils now. So this basic plate itself, and I'm giving away a trade secret. This plate alone fixes so many women with hormone imbalances. Just following this 3 times a day, you'll be surprised at how much you can actually achieve in terms of hormone balance. In terms of specifics, nutritious foods that you can include in your daily life. So seed cycling is something that Dr. Visalam, I know, uses a lot. It's wonderful to, cycle the seeds. So you can look up seed cycling anywhere online. So it's basically, you'll have your sunflower, your flax, your sesame, and you just cycle through the seeds and make sure that you have enough of the lignans, the fibers, the phytoestrogens that help to balance out the entire period cycle. And of course, we have spoken about the brassica family vegetables, the sulforaphane. So again, having in the season, and this is again a problem in India, right? So urban India now gets any vegetable all through the year. So, I go to Chennai in June and I find cauliflowers. So, it's obviously not the healthiest of vegetables. So eat seasonally. But when you can, especially like now in the winter, including the cruciferous vegetables that help to bind to the excess estrogens and remove them. So the cabbages, the cauliflowers, the broccoli sprouts, and so on. These are wonderful things to have. Traditional foods, and I would again keep saying that, the simplest thing we have learned over 5 years is just going back to our traditional diet and what our bodies understand. Every single dish in India is often, balanced out. So, if you have a heavy dal, it will always be served with a white butter and with a piece of jaggery. And, you've got the digestive enzymes starting in the north to south process as soon as the jaggery is put in. The good fats ensures that, you're able to get in the right amount of digestive support. All the cofactors are coming in, the K, vitamin E, D, and A, KEDA through the fats, and you've got the ability to digest the food. By the time you finish the meal, automatically everything is absorbed. So eat traditional, eat local, eat seasonal, and just remember the simple plate, the 1/4, 1/4 rule. And, I would say 90% of problems get sorted right there.
Yeah, Mahesh, thank you very much for, and we can all discuss about the good fat versus bad fat, but that is out of scope right now. Thank you very much for everybody for giving an insightful about the autoimmune conditions and the diet approach and infection and gluten. Thank you very much. We are ending the session over here. Thank you, everybody.
Thank you very
much.
Ruhi,
you can just take the forward. You can take the session forward.
Our next speaker, thank you. Our next speaker is Mugdha Pradhan. She is the CEO and founder of iThrive. Over the last 3 years, iThrive has successfully treated more than hundreds of people with chronic health conditions using functional medicine methodologies and help them to be healthy and vibrant again. iThrive offers services like personalized online consulting for treating and reversing lifestyle conditions. And recently, they've added new verticals about which Mugdha will speak in detail. Over to you, Mugdha.
Thank you so much, Dr. Ruhi. And I mean, it's been such a lovely session since morning. I've just been listening to everyone. I initially was going to make a whole list of a lot of slides with case studies and all the clinical terms and everything. But I think given the amount of clinical knowledge that's been shared so far, I just decided to take a different approach. And what I want to do, and I'm really grateful for having me on board and giving me this opportunity to talk, but I thought I want to humanize the entire approach that we have. Given that quite a few of us here started on the functional medicine journey ourselves because we had to figure out our own health problems, I just thought I'd bring that perspective in and how what we are all doing here, these amazing set of people from across the breadth and width of India, what we are doing here really making healthcare instead of what it is right now, which is healthcare. So without delaying much, let me just quickly share my screen and I'll take you through what I wanted to talk about today. So you introduced iThrive, Dr. Ruhi, as a company that's reversing diseases, giving people their life back. But honestly, where we all started is the vision that we have here at iThrive is to make healthier, happier, lifestyle disease-free communities across the world and everyday reality. And it's so funny. I put this vision out and I really want to talk about this, right? Because even after my session, we are going to have a lot of clinical expertise that will be displayed. There'll be a lot of tips and techniques, tests and supplements, everything that will be discussed. But I just wanted to talk about this, that, each of us here right now, I remember hearing this doctor's vision of healing 1 million people with thyroid disease. So most of us here come with these big visions where we want to create communities free of diseases, where we want to create healthier, happier people. And what conventional medicine does is I had shared my vision with a conventional medicine practitioner recently, and they said, do your work, what you're doing is good, but, be realistic and scientific. You cannot create a planet without disease. And I just didn't understand where that was coming from. And it makes me so happy that we're having this conference where every person who's presented so far has been speaking of how they've literally taken disease away and given life back to someone. So at iThrive also, we have this vision. We want to make healthier, happier lifestyle, disease-free communities across the world in everyday reality. And why did that vision come out, right? Why did that really happen? This is where it gets a little personal. It starts with my own story, and why I want to talk about this is sometimes the audience members listening to us as practitioners, the audience members listening to us as doctors, nutritionists, whatever. I personally have a master's degree in nutrition, and I've spent the last 4.5 years delving deep into functional medicine, learning, testing, spending lakhs and lakhs on tests and supplements, and just figuring out what goes on with the human body, right? But before I became this practitioner, before I became someone who could help other people, this was me. This was me in 2016, that's 5 years ago. I was 97 kgs. All I knew was I was very, very obese. I didn't even know what was going on inside my body, right? I was diabetic at that time. I had an autoimmune, I had Hashimoto's. Of course, I was going through a lot of mental health issues. There was suicide ideation. I was financially broke. I was in a mess. And when I went to conventional medicine, when I went to the white coats that I could, like I was brought up to trust, none of them had answers, right? And that's when functional medicine saved my life, because it taught me to look at blood tests. It taught me to look for root causes. It taught me to look for like beyond the symptoms. It taught me to look for things that were really messed up internally, which could explain all the things that were happening externally. But in that journey, so we are having this conference now. This is 2021. This was me in 2016. At that time, I was literally doing this alone. And I'm sure a lot of the practitioners who spoke today, before we all came together and formed this amazing collaborative community, we all went through our journeys alone. And for me, at that point, I decided that, if I recover from this, if I really get well, what I want to do is offer the space for other people to heal. And that's how literally iThrive was created. We decided that this is not the way healthcare should work. No one should be fighting their paths to health or figuring out how to get healthy on their own. They need the support of caregivers. They need the support of practitioners with knowledge. They need the support of people who know what they are talking about. And through that partnership is where health really begins. So this was me. This lowest point is what inspired me to really create iThrive. And from there, we have now gone to this place where it's not just about like doing blood tests and analysis, right? We do that. We do the root cause analysis. We do complex tests. We do the GI map. We do the OAT test. We do the Cyrex autoimmune assays. We do the Cyrex food allergy test. We do a whole lot of tests, but it's beyond that, because what we realized in doing all of these testing in what we call as not just the root cause analysis, but what we call as the root cause synthesis is we realized that when we are looking for the root cause of someone's health problems, it's such a multifactorial thing that one has to address, that it's not enough to just do the tests and do the supplements and do the diet. You have to go beyond that. And I'll talk a little bit about that later. But through our evolution, through all the work we started doing, iThrive, of course, as the one-on-one personalized coaching program, always has been there and will continue to be there. But we also launched the iThrive Academy because, again, this is my personal experience. What I saw is that there was a lot of misinformation, even in the traditional nutrition community, even in, of course, conventional medicine. We all know that. We've spoken about that since morning. But even within the functional medicine practice itself, I could see that there was a lot of misinformation. Some recommendations were outdated. Some weren't really making sense anymore. So we launched the iThrive Academy because we wanted to offer the entire cutting edge research that we do in-house as a team to whoever wants to learn about it. And when I say cutting edge research, we actually have a full R&D setup we're doing our experiments, we're doing our clinical trials, we've gotten ethical approvals to run clinical trials, and then we keep sharing this information. So we launched the iThrive Academy so that we could share the knowledge that we have with our sisters and brothers in the community who want to learn more. And I think Suyash spoke about supplements just before I came in to talk. But then what we also did is we launched our own line of supplements called iThrive Essentials, because every practitioner here knows the struggle that exists for good quality supplements when we have to recommend them to our patients. And then when our patients have to go, acquire them. So even if they're ordering from Amazon, there are delayed timelines. The quality sometimes is really questionable. You never know what fillers are there. And then even if you're ordering the best quality, you still end up paying so much for customs duty, especially if you're in India. So we were like, our job is to solve our patients' problems. If supplements is becoming an issue and getting in the way of healing, let's make our own supplements. So right now we have these 3 amazing things. And before I go on to the next slide and actually talk about the cases we work with and how our approach works, what I also wanted to talk about, see, a lot of us rely heavily on blood work, a lot of us rely heavily on testing, but sometimes the disease is not just in that, right? Sometimes somebody's disease is created by factors beyond what's happening just inside the body. And we realize the need to have a complete multifactorial approach to kind of help someone recover from the health problems. So we started looking at all the other modalities. Dr. Visalam actually spoke about this. She spoke about sound therapy, acupressure, acupuncture. We had a presentation entirely about ozone therapy that happened earlier. And what we discovered is healing is never one-dimensional. Healing is never unidimensional. Healing someone from a disease requires us to go into all aspects of their life. And that's what we started doing at iThrive. So the research and development team here just keeps coming up with more and more science-backed understanding of how diseases can be created. Like even vitamin D, something that we spoke about. What we found out is that vitamin D deficiencies might not entirely be because of lack of supplementation or because of lack of sunlight exposure. Sometimes if there are chronic infections, the body can proactively sequester vitamin D and prevent it from being highly bioavailable. And you might see that the vitamin D levels are low in your blood work, but there could be other reasons why that's happening. And at that time, heavy dosage of vitamin D might be counterintuitive in that case. We saw that even with anemia, right? So a lot of women who come to us have underlying anemia. And what we discovered there is that the anemia was not just about iron levels. The anemia was not just about protein. The anemia was not just about B6, B12, copper, or any of those nutrient factors. There were a few cases where they had chronic infections, and what the body was doing is to kind of make sure that the pathogens, because iron is like candy for pathogens, right? So to make sure that the pathogens weren't getting access to the iron, the body was sequestering iron and keeping it away. So in those cases, when these women had gone to conventional medicine practitioners that they had heavy anemia and they had received iron transfusions or they had received iron supplements, the case actually got worse. And when we started working on the chronic infections, reducing that viral bacterial load, automatically the body started releasing that the iron that was sequestered in different organs, and the anemia kind of went away. So there are so many nuances to really understanding a disease before you start treating it, that we became completely multifactorial in our approach. And like I was sharing just now, the reason why we went multifactorial is because sometimes the disease can be created from what's really going on in the mind of the person, right? Sometimes the disease can be created from an external stimulant such as a pathogen. Sometimes the disease can be created because of a toxic exposure. We had one case whose CBC was so messed up, and everyone was trying to figure out why. He did not have, like, the CBC looked like it was somebody who had cancer. That kind of a CBC panel is what we were seeing. And as we investigated further, we found out that he was a plant supervisor who worked with BARC and all of these atomic government institutes. So he would spend a lot of time in these and he said, no, it's impossible, that radiation doesn't impact us. And then you're like, okay, look at your blood work, right? So sometimes it becomes so important to understand what is it that this person does on a day-to-day basis before we even just start looking at blood work and say, okay, let's treat this, let's treat this, let's treat this. So many times we've had people who've gotten sick because of the work environment that they were in. I had a lady with fibromyalgia. Of course, we did the entire, we've spoken enough since morning about gluten and the microbiome and deficiencies and all of that. So we did all of that, and we saw a 70% resolution in her symptoms. A lot of her pain and her chronic fatigue and all of that went away, but 30% was still there, right? And for us, like, no case is complete unless we see a complete turnaround and a reversal. Now, what we figured out as a pattern in her case was she would be relatively pain-free on weekends. And then Sunday evening onwards, her pain would start increasing in intensity. Monday morning, the entire body would start getting really jammed. But by Thursday evening, it would start tapering down. This started becoming a repeated pattern. So we then went deeper and asked her, what happens on a Sunday evening, right? Where do her thoughts go? And then it was like, I start thinking about work and office, and we figured out she was working in a really toxic environment. She had a very abusive boss and very, very competitive environment. So her body really was reluctant about taking her to work every day, and it was sending signals in all possible ways. We've spoken here how the symptom is not the cause. The symptom is actually just a reflection of the cause. As soon as you find the root cause, the symptom starts disappearing. So in her case, the root cause of the remaining pain and the symptoms that she was experiencing of fibromyalgia, of no energy, of fatigue, all of that were coming from the fact that she was living a life she did not really like in terms of her career. So a lot of counseling went in, and then she realized that this is what was happening. And the minute she put in her papers and she quit her job, the rest of it was gone. She didn't have any more fibromyalgia symptoms, right? So this is why I speak, even when I speak with the team. So we have an entire team of 15, 20 people who are working on all the cases that we get.
Mugdha, 5 more minutes.
Yeah, I'll be done. I just have to quickly take people through the unique cases that we've treated. So this is why I tell the team also that when you look at a patient, you don't look at the patient from blood work, supplements, deficiencies, toxins perspective. You look at the person as a whole, because when you speak of holistic healing, it really is that, right? So we use functional medicine principles. I have found it to be the most valid, repeatable way of treating someone, because I've never seen it fail. And that's why we are all here having this conference, right? Like, the blood tests never lie. The advanced tests never lie. We get the data we need. But there is an approach beyond that which really brings about healing. And there are these really weird cases that we had to work with. So we got one kid with a thyroid issue, and initially we just thought it was his food choices that was like triggering his high TSH levels, and we did the work on that. Soon there was some improvement in his TSH levels, but it was not really where we wanted to see it. And as we went deeper, then we started looking at what was going on, and we then discovered there was a childhood incident after which his thyroid had gotten worse, and there was a head injury or something, or he had lost consciousness. He doesn't remember what happened, but something had happened to him, he said, in my head. And after that, my thyroid went up. So we just asked for a MRI of his entire brain and thyroid, and we found out that there was a pituitary tumor that was driving the thyroid high, right? So sometimes you go beyond tests and you look for imaging. We had a case of inflammation and hives, and again, we thought it was food allergies and food sensitivities that was creating the hives and the inflammation. Like, this guy needed a cetirizine every day, otherwise he'd be scratching himself to death by afternoon. And in his case, what it turned out to be was an MTHFR mutation, right? So we had to go the genetics way. There was a lady who would come with severe anxiety and depression. Again, there's been enough discussion on the gut dysbiosis, so I'm not going to spend too much time there. But there were so many pathogens in her gut that her brain was in this continuous threat, hypervigilant state. And that was triggering a lot of her anxiety and depression. We had this lady with IBS who couldn't absorb any nutrients, no matter what quality of supplements we gave. It didn't matter, right? There was just no absorption happening. She kept losing weight until we went deep with our Minds That Matter program and found out she was like literally going through an existential crisis, right? She didn't know why she was alive. She didn't have a purpose on this planet. And in her mind, because she didn't have a purpose on this planet, her body was just refusing to stay alive. So we had to go that deep into subconscious programming and, work on that level and change it. We've had fibromyalgia cases where it's been an Epstein-Barr virus overload. We've had vitiligo that was pathogen-induced. Like I spoke of anemia that was due to chronic infections, right? So what I really want to kind of quickly wrap up with is while we all practice functional medicine, I'm a nutritionist who practices functional medicine. What I found out is that it goes beyond that, right? And I think all of us, the more we recognize that a human being is not just the body, a human being is body, mind, spirit, soul. And then when we encompass all of that, bring all of that in, and then like really are there for a patient to heal them in whatever way they need, right? So if they need knowledge, we offer them knowledge. If they just need that support and the coaching and taking it one day at a time, we offer them that personalized service. If they just need good quality supplements, that we'll produce. But if all of us collaboratively started thinking of how we could make this bigger than just one thing, just one practice, one dogmatic approach, that's what I just want to leave this session with, that in the end, our overall goal is to kind of create a planet free of diseases. And the more approaches we have, the better it works for our patients. So I think I'm just about in time, and anyone wants to add anything here, I would love to hear your ideas.
We'll take up one question, Mugdha. How did you treat the pituitary tumor?
So we didn't treat the pituitary tumor. That is something that had to go to conventional medicine, but at least we found it, because this guy was suffering for 13 years without any understanding of what was going on. All that conventional medicine was doing until then was just trying to adjust his thyroid doses, saying he was depressed, saying he was doing this for attention and all of that, right? So, I mean, I still don't have the surgery vertical at iThrive. Maybe one day I will. but we found that, right? So that was the root cause. So that's the thing, right? Like you find the root, then the patient recovers. Otherwise, you're just doing like symptomatic stuff.
Yeah. Great. Thank you. It was lovely having you here. Thank you.
Hi, everybody, and thank you for your patient hearing. What I saw was we had 250 participants and none of them left in between. I think kudos and clap to all the speakers. Before I give you 10 minutes bio break, I have a very sad announcement to make. And this is in loving memory of Dr. O.P. Verma. Dr. O.P. Verma was invited to be a panelist of our metabolic syndrome panel. And unfortunately, we lost him a few days back. So I want all of us together to send prayers to him, to his family, and deep condolences to Dr. Verma and family and friends. Thank you, guys. And we will meet at 12:15 sharp for a very, very informative, mind-boggling talk by Dr. Sri Kumar. He's one of the veterans in this industry, and I personally really look up to him a lot. So enjoy our bio break and be back with us at 12:15 sharp.
Live Biopharma. At your service.